I'm Pati Papineau and welcome to my show. Today's show is not for little children, so this may be the time you might want to ask them to leave the room. Unless you've been living under a rock for the last 10 or 15 years in America, you've heard about a virus called AIDS. And that's what we're talking about in today's show. And I know many of you have been very loyal, faithful viewers of my show. We've done almost 140 some odd shows. And you're saying, why on earth is Pati Papineau doing a show on AIDS? And the reason is because it affects all of us. And because it's now here in Vermont and very strong, making a strong presence here in Vermont, it is not a disease of just homosexuals and homosexual men. It's a disease that is here and now, and we must learn about it. And my guest is an eminent expert in the field. She is the director and the coordinator at the Rutland Regional Medical Center in Rutland, Vermont's AIDS Clinic. And when I talked with her briefly to set up this show, even she said to me, Patti, the technology and the scientific data is changing so constantly that even I, as a healthcare expert, can't always keep up with it. And so that in itself explains why we're doing a show on this. And I'd like to welcome Elizabeth McGrath to my show.
It's a pleasure to be here.
Well, it's a pleasure to have you because we have so much to talk about. Everybody knows that people die from AIDS. Let's get that right straight up. You still die from AIDS. It's not cured.
Unfortunately not. It is not a curable disease. It is still considered a terminal diagnosis. However, people are living longer and healthier with this diagnosis, much, much more than from 10 years ago.
Okay. And we will certainly explore why and what some of the therapies are and the medical technologies and the medicines that are helping people live longer, healthier lives that are diagnosed with AIDS. I'd like to, first of all, say children get AIDS. And
absolutely.
babies can be born with AIDS, so it can be transmitted in the womb.
Yes.
We've talked about, everybody knew it was a gay man's disease. It still is. That has not changed.
Correct.
However, it is into women and even people, elderly senior citizens.
We do have some people who are considered senior citizens with the diagnosis of HIV and AIDS, yes.
And it's also in the heterosexual community.
Correct.
So I think that this, if nothing else is learned in this show, if you're participating in sexual activity and sexual relations with another human being, you better be using a condom and taking extraordinary precautions and not think that you're exempt and you're okay. And if you had, let me just ask you one other question. If you have a sexual partner in, let's say, the spring or the summer,
yes,
and then Labor Day weekend you take up with another sexual partner, should you have an AIDS test between these two partners?
Yes, you should. You should have an AIDS, a test for the HIV antibody anytime you engage in any unsafe sexual behavior or using dirty needles, anything where blood or semen are passed from one body to another.
Oh, well, I got two questions from that. Let's very clearly define unsafe sexual behavior.
Unsafe sexual behavior would be receiving sexual secretions, semen, vaginal secretions from someone without the use of a condom.
So what about saliva?
Saliva is not considered a high-risk behavior, so kissing is not considered a high-risk behavior. When we talk about high-risk behaviors, I like to think of it in terms of like we think of in the food pyramid. And so unsafe sex is right at the top. Not using a condom and having vaginal intercourse is right at the top of that pyramid. Deep kissing is at the lower end.
And what about anal sex?
Anal sex, again, is a receptive sex. So yes, you're at high risk if you are the receptive partner.
So that's at the top of the list with intercourse?
Absolutely, because it is a form of intercourse.
Well, yeah, oh yes. Well, I knew that, but I think it's very important that we get it very clear and people understand very specifically what the situation is. When a person gets tested,
yes,
what is involved in that test? Is it a simple blood test like you get for a CBC or an electrolyte?
Absolutely.
Or mono? Or
that is all it is.
Just a basic 1-2 blood test.
That's exactly right.
And it can be done in any laboratory?
It actually is not done in every laboratory, but every laboratory associated with a hospital or clinic would have an ability to send it somewhere and have it tested. But you bring up a very good segue for me to bring up the difference between confidential testing and anonymous testing.
Okay.
Confidential testing is if you, Patty, felt that you were at risk and wanted a test, you would go to your primary care physician and say, "Doc, I really think I need to be tested." And he would write you a slip of paper, and you'd go to the lab, and it would be Pati Papineau having a test for HIV. It would be on your medical record. It would be confidential. Any medical record of yours is kept highly confidential by all healthcare personnel, but you would have it on your medical record. But the difference with an anonymous test is if you wanted to have your HIV status determined anonymously, you would come to an anonymous testing site, and you would have us assign you a number. We would draw the blood, send it off to the state health department, and it would come back to us directly. And then we would discuss your results.
My question to that is, when it goes to the state health department, and you go under Susie A.
Yes.
It's an anonymous name, there's no name.
There's no name, it's a number.
Okay. And then when it's tested positive, does it go in the Vermont state health records that this Susie A. anonymous donor on whatever the date was tested positive, so they have a record of how many are tested positive in the state on a particular day or year? The
only way we have statistics on HIV and AIDS in the state of Vermont is because AIDS is reportable to the state, as many of the sexual transmitted diseases, such as gonorrhea, syphilis.
Well, that's the way it is in New York State. Many states have that law.
Correct. We do not report people who are HIV positive, however, only if you have the diagnosis of AIDS. So if you came to me and you had the diagnosis of HIV, I do not report you to the state at this current time. That may be changing in the future, but right now, no. As long as you are not an AIDS diagnosis, I would not have to report your name.
Something you just said a moment ago, in a perfect world, medical records are confidential. However, we do not live in a perfect world, and unfortunately, I personally, and people have known, and I'm sure you have heard many stories, being in the director of the clinic that you are, where somebody thinks that it's private and it's kept in the doctor's office, but the doctor's office is, there's leaks, and the lab people leak, and there are people who talk, and they shouldn't, and it's wrong, it's unprofessional, unethical, it does happen. So sometimes people do seek to go out of state.
Yes.
I think it's important to say here, and I'm not attacking the medical profession, but it happens in the legal world too. People do talk when they shouldn't. The important thing is to get a test, no matter how you get it or where you go to get it. The important thing is to get tested if you're going to change partners.
I think it's important to get a test regardless of your status with your partners. I think it's important to get a test if you are engaging in high-risk activity.
Okay.
Getting back to the confidentiality, however, I think that one of the when this clinic system was set up, prior to 1994, there was only one HIV specialty clinic in Burlington.
In Vermont.
In Vermont, and it was located in Burlington. And then we decided to look at housing these other satellite clinics, if you will, in hospitals, major hospitals around the state, but also hit all 4 quadrants of the state. One of the issues around that, we sent out questionnaires to people who are infected, and we said, look, tell us what your concerns are about having a clinic in your community. One of the top ranking was confidentiality. They said, gosh, I am so afraid to go in there and someone is going to know me. I have to disagree a bit to say that people talk, in that my experience has been very, very good with confidentiality issues. I think it's changed over the years, so I'm not saying we were always lily white in this situation, but as far as the HIV and AIDS clinic, that is such a very touchy subject that we've all been very, very well educated. And I think you can feel fairly confident. But I literally have had patients walk in and see somebody that they may know and turn around and walk out because they're feeling, oh gosh, I don't want to be associated. One of the things we've done to protect confidentiality, though, is each of these clinics are housed in another outpatient setting that doesn't say AIDS clinic, and it doesn't have any identifying information so that no one would have any idea why you were there at that clinic.
Well, these are all such important steps, because I would imagine that if there's any reason a person wouldn't be tested, it would be terror.
Absolutely.
So even if you don't change partners, if you are involved in a sexual relationship either, and if I'm wrong, please tell me, either gay or straight,
absolutely,
you need to be tested.
Especially if you don't know the history of that sexual partner. And the other thing, the other caveat to throw into that, if you are using intravenous drugs, and especially if you're sharing needles, because that is a high-risk behavior, and we are seeing more patients like that in our clinic settings.
We should say right now that there are 4 satellite clinics in the state of Vermont. Burlington, it still exists.
Burlington.
St. Johnsbury, Rutland, and Brattleboro. So it does hit, as you say, the 4 quads areas of the state.
Yes.
You are nonprofit.
Nonprofit, that's
volunteer
right.
free. I mean, anybody can walk in. You don't have to feel like in a private doctor's office where you have to go up and you are there to help people.
Absolutely.
There are many of these brochures available to anybody. It's called Take a Positive Step. I was going to say a private step, but that's true. It tells all about the clinics and some information. It's available if they call the Rutland Regional Medical Center, your particular clinic and office.
Yes.
There's an 800 number around the state people can call.
That will hook them up to any one of those 4 clinics.
To ask any questions, and does a person have to give their name?
Absolutely not.
Okay, so that
absolutely not.
This could be peace of mind.
Absolutely.
For
and
almost
that's our
anybody.
purpose with it. Help people to take that positive step. And by positive step, we mean get in, get tested. If you're positive, we really want people to understand that you can live a very long time with HIV. You have to be on appropriate therapies, though. As you mentioned before, therapies are changing every minute.
Well, you're the one that told me.
And the reality is if we are on top of it and you get early treatment, you will be well for a very long period of time. But it's very, very, as you said, there's a terror factor here. And it's like the person who smokes. Do I want to go and find out I have lung cancer? No. You know, you want to believe that you will not get it. You practice high-risk behaviors. You don't believe that you're at risk. And so you just continue to do it, and then you make it sick. And that's what happens. About 62% of our patients who come in as new patients are really in advanced stage disease. So people aren't getting tested, and that concerns us greatly. The other thing that concerns us is that we're not very good at our prevention message either. You know, we're not helping people to understand what high-risk behaviors are, or not helping them to modify their behaviors.
I guess what I just have as a human being, and a woman, and a mother, have a hard time getting from A to B in what you just said, is that if I thought for a minute that I had lung cancer, I'd be to the doctor so fast to find out, to prevent it, to stop it, to incubate it, and do whatever I can so I don't hit, or that I can prolong my life at a higher quality. So I can't understand why. I can understand terror and fear and embarrassment. Those are quality. We all can understand it because we've all experienced it. But when there is clinics and brochures and information free and available to everybody, an 800 number, and I'm sure there's clinics in every state in the country. We aren't just talking about Vermont, but of course we're based here, so this is our primary focus. Anybody that doesn't get tested, that's participating in having a sexual relationship or an affair with anybody, is got to be really stupid.
I don't think it's a matter of stupidity.
Well, how could, because it's a disease, you die.
But I don't
it's highly contagious.
I don't think that people, by and large, believe they're engaging in high-risk behavior, number one.
Well, if you're having intercourse, or anal sex, or oral sex, are we right up there?
You're right up there, absolutely. But again, you may not perceive your partner as high risk. You may not perceive how many people would just sit down and disclose all their sexual partners.
You know, I'm so glad you said that, because I've known so many people. And you said, you have to know the history, the sexual history of your partner. Who really knows? I have friends, women friends, who've had relationships and affairs and well, how do you know he doesn't have AIDS? Oh, he told me. What did he tell you? He told me he was tested. Well, what did he say? Oh, he said it was positive. Well, did you see that? It's like being a lawyer. Did you get the black and white paper and the test results? I mean, who's going to say yes? And I had syphilis and gonorrhea and herpes and I mean,
and you can't always be 100% certain. You're right. You have to always say, even if you have a piece of paper, what was the date of that paper? And
Right.
since that test, have you had
Another.
retesting or have you had another high-risk encounter?
Right.
So you're right. It's not always 100% fail-proof that you're going to feel 100% safe. And you have to use some reason. But you're right. The message you're giving is a very good one. We have to educate ourselves and we have to be proactive to keep ourselves healthy.
Let's take it. It's a basic blood test in the arm.
Yes.
How long does it take for the results to come back?
Depends if you do confidential testing or through the state health department, the anonymous testing. If you came to me for confidential testing, it would take a matter of maybe a week at the outset. With sending it to the state lab, it might take up to 2 weeks depending on the mail,
backload.
that sort of thing. There are various factors that go into that. But if you come to me for anonymous testing, I'm going to tell you it's going to be about 2 weeks. And I'm going to set you up to come back and see me in those 2 weeks.
I see.
I counsel you before you have the test and I counsel you after you have the test because I want to know what are the high-risk behaviors, educate you, counsel you, try to keep you safe. There are people that have consensual sex, Patty, and those are the people you can't, understand why are they doing this. There are also people who are forced to have sex against their will.
Well, a rape.
That's right. That's right. Or an abused partner whose husband may be cheating on her, and let's not be male bashers here.
But
vice
it happens,
versa.
or vice
but
versa.
vice versa.
Or a spouse is cheating.
That's right.
We've all had.
And we don't know that.
It exists. Right.
We don't know that. So, there are people that just don't know that they may be at risk too.
That's right. All the more reason.
That's right.
Just because, help me if I'm wrong, but what you're saying is just because you might be in a long-term relationship or a live-in situation or maybe even a marriage situation doesn't mean you're 100% safe, you'll never get it.
Well, I think that that's very true. I think that that's very true, but I again would like to really concentrate on that high-risk population. Not to say that people should bury their head in the sand at all. I think that we all have to sort of take inventory, take stock of our lives, and really take a hard look. And that's what I'm asking. And I think that's why you say, I can't understand why people wouldn't know or be concerned. And I think sometimes we don't always, want to see what's going on in our lives.
I think so too. Let's talk about teenagers.
Yes.
Same thing. It's kids who are promiscuous and.
Unfortunately, the highest risk or the highest rate of infection right now is in the less than 25-year-old population. And
Scary, huh?
It is. And that's why we see the highest death rate being in the 35 to 40-year-old range, because it takes that long for the disease to really run its course and become terminal.
Let's take a specific situation. And I'm asking this because I'm curious. And I know very little about AIDS. And that's one of the reasons I told you I wanted you on the show, to help me to understand more. And hopefully some of our viewers. We all know the Monica Lewinsky-Clinton situation. Could AIDS be transferred through that situation?
It can. We have had documented cases, but it's not a huge amount. And so, again, it's on that lower end of the pyramid. We don't know the full extent. It's very hard to follow that, because if you're engaging in oral sex, and we might ask Monica the same question, is there other activity involved? And so it's very hard to sort of tease that information out. But there have been some people who have believed that that's
so it is
transmitted
possible.
that way.
I guess what I'm trying to say is that if it is possible, then if you're just engaging in that kind of an oral sex relationship, you shouldn't feel that you are immune from getting AIDS.
You should not feel you're immune from getting AIDS. Absolutely not. You're right.
So a test comes back either negative or positive within a week or 2 week period. It's got to be the longest week of somebody's life.
Absolutely.
And you tell them that the test was positive. What is the difference between being tested positive and having full-blown AIDS?
That's a very good question. When we test for the antibody. In other words, you are infected with something and your body mounts an immune response. And so you build up these antibodies. And that's what we actually test for. We don't actually test for the virus. So the next step, if you're positive, you would come to see me and we would talk about getting tests to really measure how much virus is in your body and how it's affected the immune system by doing another blood test. The HIV virus affects the CD4 cell, which is one of the cells in our immune system. which keeps us from getting specific types of infections. The AIDS diagnosis comes when your CD4 count is below 200. You and I, Patty, would have a count greater than 1,000, okay? So if you're, a big difference, and that's usually over many years. So if your count is below 200, or if you have an associated, what we call opportunistic infection. Now by that I mean, if your count is below 200, that's when you start getting some infections that you normally would be able to fight off. Some types of pneumonias.
Or a flu or something?
Not a flu.
Not
they're
a flu?
very specific, and they're actually defined by the Centers for Disease Control in Atlanta. We have a list, and say you get PCP pneumonia, which is pneumocystis pneumonia, and your count is below 200, you automatically are defined by the Centers of Disease Control as having an AIDS diagnosis. And there are many opportunistic infections that you can get. So if you have those types of things, then you would have the AIDS diagnosis. And the AIDS diagnosis is important, number one, because that's the way we used to treat. We would wait for that diagnosis. Now we're not waiting at all. We are treating up front, and we're treating very aggressively.
Before the real symptoms set in.
Yes.
I have another question, and that is, when a person is tested sometimes for a specific disease, such as AIDS, or like a chronic fatigue syndrome, and sometimes the symptoms in the blood test can come back and it can kind of mask itself around other diseases. Like chronic fatigue can sometimes look at fibromyalgia or lupus, and it kind of can be, it can have other associations. I don't know what that's the word, but manifestations where it might not be AIDS. Is that possible, or is the AIDS test so very specific that it's clearly yes or no?
Excellent question. It is so clearly specific, it's yes or no. And the other tests that we do, the CD4 cell count and the viral load, those are very specific, and they would not be used for any other disease.
They would not?
No.
Okay.
They would not, no. You would be very clearly be able to establish the diagnosis of HIV based on that simple blood test that we do up front.
Of the people who are tested that you see and that you are aware of, and not just in Rutland Clinic, but I know you've worked around the state and are familiar with above and beyond just the Rutland Clinic, of all those people who come back testing positive for AIDS, how many have other sexually transmitted diseases along with that?
That is a good question. I don't have a specific statistic to give you, but I would say in my personal experience, I would say probably
half.
At least half might have another type of sexually transmitted disease, whether it be herpes. I have seen people who have had syphilis associated with it. And there are so many sexually transmitted disease. Anal warts is another example. We see that a fair amount. So yes, other sexually transmitted diseases are seen in these patients. And we know that if you have a sexually transmitted disease of another sort, you're at higher risk because you may have open lesions, which put you at risk to developing or getting exposed to the virus, if you will.
When a woman is raped and she goes to a hospital and the rape test kit is performed on her, is there a blood test automatically given for AIDS?
I don't know that, Patty. I do not do that type of counseling. However, I'm sure that they counsel her around that, and I'm sure that they do the appropriate testing or set up the appropriate testing, but I don't know that for sure.
And this may be something you're not aware of, but if someone is arrested and goes to a prison or a jail, is a mandatory testing done?
I don't know that mandatory testing is done anywhere. I think that they are given the choice, the option, but I'm not sure that it's mandatory. I don't know that. We do know, though, that the incidence of HIV transmission in jails, in prisons, is increasing.
Very high.
It's increasing all the time. So it's a very high-risk population.
And of course, that would be more gay sex.
Well, absolutely, because they're all one sex in there.
There you go. Unless there's something's happened since we've been sitting here, which probably not. No.
Probably not.
Probably not. If you just tuned in, I'm talking with Elizabeth McGrath, who is the Director Coordinator at the Rutland Regional Medical Center for the AIDS Clinic. And we are talking about the AIDS disease and the new technologies and new medical breakthroughs that have happened in the disease, how it's in affecting Vermonters, and what can be done, and some of the really active diagnosis that is being done now in this country. And please be aware before you change the channel that the AIDS disease and the AIDS virus, the technology and the diagnosis and the medical treatments are changing constantly. And even from 1994, which is only a couple of years ago, changes are happening.
Absolutely.
And you told me on the phone that even changes had happened in the last year.
Absolutely. They're happening all the time in terms of treatment, in terms of how it's being looked at, in terms of, epidemiology. As we said earlier in the show, we used to be a gay man's disease. Now we know it affects children, it affects females, it affects heterosexual couples. It's a disease that can happen to anybody.
I have a question, and this is not a pure program for children, but if a person has oral sex with another person and a man ejaculates into another person's mouth, that's transfer of semen, even though the saliva, which you said is on the lower end, that still could be an AIDS transmitted.
That's what we touched upon earlier when you asked, was oral sex a high-risk behavior? And yes, we believe it is risky behavior. Again, is it as high risk as anal intercourse? No. But the reality is we do believe that there are documented cases that support that.
Right. Earlier we were talking about oral sex, but I mean now ejaculating into another person's mouth.
Well, again, I've considered that a form of oral sex. So
well,
I think that's
too.
what I was talking about.
I do too, but I mean, some people might.
And I think that, yes,
to be very clear about it.
The risk is the ejaculate,
right.
yes.
Right.
Yes, not the saliva.
Very, very important. To what degree does a condom prevent AIDS?
Well, the condom does prevent AIDS. We see that in couples who one partner may be HIV positive and the other negative, and they use a condom. Over years, we test the negative partner and they remain negative because of the use of condoms. It is a barrier contraceptive device, but it keeps those fluids from, number one, depositing, yes, and coming in contact with the vagina or the rectum.
All the difference. So it really is the key. And this is the other thing that amazes me, is that people who participate, have affairs and have anal sex and oral sex and intercourse, and all you have to do is buy a condom. It's available, and even in supermarkets, it's right there, it's accessible, it's easy, it's inexpensive. It can save your life. And to parents who sometimes say, oh, I wouldn't allow my child to use a condom or a birth control. Excuse me, it isn't so much about birth control, it's about saving your child's life if they're going to participate in a sexual activity. We all hope they're not, as parents, going to participate and be promiscuous and at 13, 14, 15, 16 or whatever. But if they are, it saves your life. It's that simple, right?
Well, but the conversation does become that base, and people do not want to believe that their children, or that they don't want their children exposed to the conversation. There are high schools that do not want this kind of education going on, because if I say to a high school student, you need to use a condom, then parents believe that that will give them the message that it's okay to have sex.
Right, just protect yourself.
That's right. And in fact, what we do need to do is, like you, I need to know how is it transmitted. I need to know what I can do to protect myself. These are the things that we need to educate these kids around. And the whole issue around needles. We know that there are drugs on the streets of Rutland, Burlington. I want to say Brandon, I want to say Middlebury. I mean, I don't think we can bury our head in the sand. So we have to protect the people who are participating in these high-risk behaviors.
So very important. Everything that you're saying is just, really is life and death.
And it's just becoming educated and becoming proactive and protecting yourself and just, living a healthier lifestyle. A lot of our work, too, is around risk reduction. We know that people participate in high-risk behaviors, and we can't change that. I don't have any prostitutes in my clinic, but what I will say to you is I think that there are prostitutes that
they just don't get paid. They're promiscuous, but they aren't.
And that are out there. And those are people who, they have a lifestyle. And they're not going to change it. They need to put money on they need to earn money to put food on the table. we know we're not going to change those behaviors. Or an injection drug user, somebody who's highly addicted, who's going to be using drugs, you're not going to change them. So what can we do to decrease their risk? And that's clean needles, that's the use of condoms, the availability of testing, all those types of things. So again, we're not all on the same socioeconomic class. We all have different lifestyles and we all have different realities, and we have to be open to that in this field.
There is something else that should be mentioned here. I have seen documentaries on TV in recent years on gay men and gay men's sexual orientation, and that oftentimes when gay men go to cities or places where there are gay bars or gay-oriented, I don't want to say facilities or whatever, that the promiscuous sex there is very rampant. That people, they go into the bathrooms and gay men will have sex with somebody they don't even know.
Yes.
And that kind of activity goes on. And it's foreign to us who live in a heterosexual society, but that does exist and it's very real. And that also is something that we should just talk about. That's considered promiscuous sex as well.
Well, I would give you the same...
if they don't use protection.
I'd give you the same analogy, though, of all the husbands and wives who are living their straight little lives here in Vermont but go to a big city and might, use the services of a prostitute, male or female. Yeah, I think that behavior exists. I know a lot of homosexual couples, female and male, in this state that are as monogamous as my husband and I of 22 years are. I think it's just the reality of, it's not, I don't want to stereotype is all I'm saying.
No, and I don't either, because certainly there are homosexual relationships that are very loving and caring and faithful.
Absolutely.
Exists.
Absolutely.
But there is that side of the homosexual, the gay men, where that exists. And it also exists with teenagers who, will go out and have a date and have sex tonight, and then next Saturday night have a fight with your boyfriend and go out and just to retaliate or anger or whatever,
That's my
have
point
sex with somebody else.
That's my point exactly. It's young children, it's you and I with our current partners, it's gay.
Well, I don't have a current partner, so.
It's gay, it's straight, it's whomever. It's not just gays. It's my only point, but you're right. People will engage in high-risk behavior without really thinking about it beforehand, not really putting it in that category. I think the whole issue around gay bars and that sort of thing is around the issue of society treating them as different. So, and treating them as an anomaly, thinking that that kind of lifestyle is abnormal, so therefore they have to do things in a different way. We could get into that whole
that's a whole nother
argument.
Show.
That's right.
But it certainly, it all comes down with being careless.
That's right. That's right.
And
not protecting yourself,
right,
or someone else.
I mean, it's like getting in a car and not buckling your seatbelt.
That's right.
Or going out in the rainstorm and not wearing a raincoat or bringing an umbrella and just standing out there and...
Absolutely.
It's not good common sense.
Absolutely.
But what happens is that we as parents and we as heterosexuals and we who live in this wonderful, beautiful little state of Vermont think that this is somebody else's problem.
Correct.
And it is not.
Correct. It is here. It is in Vermont. We have documented cases. We have 4 clinics. We're seeing collectively 50 patients a year, 50 new patients a year. We see patients, if you looked at all 4 clinics, we see about 1,600 patient visits a year. So it's a very active clinic. It's alive and well, and people are doing very well in those clinics.
Let's talk about that. How many do you know, and can you say how many diagnosed HIV AIDS patients we have currently in the state of Vermont?
That we can only estimate. And the Vermont State Health Department has estimated there are between 350 to 450 patients or people who are living with HIV. The patients that we know of are the ones who go for testing and are diagnosed with AIDS. Those patients are reported to the state. When I talk about reporting to the state, I work with the state health department very, very closely. There are 1 or 2 people associated with the AIDS program. They're the only ones who have access to this information. That information is extremely safe. I have no problem, reporting those numbers. And really, they're interested in the numbers. They're not interested in the name, because the numbers help us to get the services that we need. But I would say that, the estimate in the state of Vermont currently for people living with just HIV and not talking about the AIDS
full-blown
diagnosis
AIDS
is about 350 to 450.
Okay. Of those, what are we talking? Children, women, adults,
No,
heterosexual,
again,
homosexual?
I would use the statistics I know, and that is the majority of our AIDS diagnosed patients are still male homosexual. It's about 60%. And then you have about 20% that are injection drug users, and then lesser percents of heterosexual and other other categories. But the majority are injection drug users and the homosexual.
The gay man.
Yes.
When a person comes to you and the test is positive, and you work with them and you counsel with them and talk with them, and they need that emotional and psychological support. Sometimes they need more psychiatric support.
Absolutely.
And that is available.
Yes, in
to
fact,
them.
one of the things we do. I'm one person, and I can't do it alone.
No, there's only one, Elizabeth.
We have a team approach to our patient care, and each clinic is the same. We each have a physician who is HIV specially trained.
Well, we can talk about Dr. Grace from
Yes.
Burlington,
Yes.
who really is the foremost expert here in the state of Vermont
Yes.
on AIDS, and really is the overseer of these clinics. And once again, they're Rutland, Brattleboro, St. Johnsbury, and Burlington.
Yes. He is the director of the clinic up in Burlington. He actually is my collaborating physician. He has two partners, Mary Raimondo, who goes to the clinic in St. Jay, and Dr. Kemper Alston, who goes down to Brattleboro. So Dr. Grace has two physician partners, and they all oversee one of the clinics. Dr. Grace is the one associated with the Rutland Clinic, so he's the one I work with. And he actually,
right.
yes, they all work in Burlington as well.
So at some point, I would think fairly soon after a person is diagnosed, you encourage them to notify their partners that they should be tested.
Yes. Yes, we do. We encourage that so that we can test then the partners. If it's a woman who has born children and we know that they might be at risk, we also get the family involved. So again, getting back to what you were bringing up before, is when a patient is diagnosed, it is such a tremendous impact on all aspects. Financial, what if I don't have insurance? Psychologically, oh my gosh, how am I going to tell my family and friends? How am I going to continue to work? If I get sick, what happens? What happens if I die? What will happen with the children? So we really have many resources. We are very fortunate in this state to have the ability to use the state health department and the various funding that they have to provide patients care, to pay for medications, etc. We have the ability to tap into the AIDS service organizations here in the state. Vermont Cares is very active within the Burlington Clinic and with my clinic as well. And they're very, very helpful to get the patients housing, transportation, all sorts of services that otherwise you would not know about. So when you say, yes, can you come to the clinic and not be afraid for ability to pay? Absolutely. We have many, many services and people who are available to help people to sort through all those issues. And as you said, even psychiatric counseling. What if there is a need for that and no insurance? We have ways to get those things in place.
I would think that would certainly be a primary concern initially.
Yes.
Before, that would certainly be a primary concern. The question that I now have is that at one time we were all taught over the last 15 years when the epidemic became more known, more well known, is that you could be tested, you could have the AIDS virus in your body for up to 10 years before it would show. Now has that changed?
That has changed. I think people got mixed up. You can have the HIV virus in your body and not become sick for 10 or 15 years. Okay.
Sort of. Can I just interject?
Yes.
Sort of like Magic Johnson. It's been several years, but he looks and acts perfectly fine.
Yes. And the key to Magic Johnson is he's getting state-of-the-art,
yeah.
well, state-of-the-art medical care,
Right.
HIV specialty care, and they're able to give him the right drugs. He's compliant with those drugs. He's able to take those drugs. He's able to afford those drugs.
Right.
Those
Well,
things
makes a
all make a difference.
That's right.
When you talk about, can the HIV virus hide in your body? When you are exposed to the virus, if you become infected, you may not build those antibodies to your virus right away. And that's why it's important to go into someone when you get tested who knows about that, who can counsel you. Geez, Patty, I think, we can test you now, but we may want to retest you if this comes back negative.
And when would you retest? In a period of 2 months, 6 months?
Usually a period, depends on your exposure. It depends on when you come and see me.
Okay.
Okay? But it would be a matter of months, yes, just to get peace of mind.
Let's just backtrack on that. You have a sexual encounter with somebody. No condom is used. Should on a Saturday night or a Sunday afternoon. Should you come in Monday morning?
I think you should.
The sooner the better is what I'm trying to say.
I think the sooner the better, just so that we can sort of sit, talk, establish what the risk is, and establish is a test appropriate. Absolutely, because again, you have nothing to lose. Your anonymity is protected, and you become educated. So we encourage that kind of phone call and that kind of visit.
If that is done, and say that there's a sexual encounter, again, on a Sunday afternoon with no protection, and you go right away and have an AIDS test, is it too soon, or could it show up if it was just a few hours or a day or two? Could it still show up? And secondly, if it was that short amount of time, is there anything a patient can do, any after thing that can be done so that the virus might not get into the body yet, or is it too late?
There is nothing to date that we can do right at the time. We know that when somebody is exposed to the HIV virus in the healthcare setting, say that we know that there's an HIV positive patient, somebody gets a needle stick. If somebody is exposed to that blood, then we do have certain things that we do put into place. We put you on medicines, and then we test you, and then we watch you, and then we test you again, and just to try to prevent that transmission. There is more and more done, but I don't want people to believe that they can go out and have unprotected sex or high-risk behavior and then have a morning after pill.
Well, that's what I was going to say. I was referring to making an analogy to the birth control, abortion pill, and which is a very bad, in some ways can be a bad thing, because women have been known to have intercourse and then think they might be pregnant, so go and get the abortion pill and have cramps for a couple days.
I just wish that the message I would like to get across is I don't think we can be complacent and feel like we can engage in something like this and then feel like it can be fixed. HIV remains a terminal diagnosis. We cannot cure that virus. I believe that someday we may be able to, but I don't think it's right around the corner, and I think that people continue to die from this. And I think we have to take it very seriously.
Oh, absolutely. I mean, that's what the whole purpose of my show is, that this is not something that's
right.
light. So just to reiterate, can AIDS show up within a few hours of an unprotected or
again,
not?
That's a hard question for me to answer. Can it? It depends on your body's ability to...
I suppose in the condition you're in, whether you have a flu or a virus and your immune system is down, whether you already have a sexually transmitted disease, there's probably a whole realm of possibilities factors that
I think more importantly, if you've engaged in high-risk behavior and then you come down with flu-like symptoms, you should be tested right away. Because again, there is an early syndrome associated with HIV infection, which can be very much flu-like. You can feel very, very fatigued, very achy, feverish. You might notice that you have lymph nodes that are sore, or swollen glands, if you will, that might be very sore.
Was there vomiting or anything like that?
Not normally. It's more that flu-like, I don't feel well, I'm not feeling up to going to work today.
Somebody's color might be pasty or bad. Again, a low-grade temperature.
Yes.
Okay.
Yes.
And how long might that last? Just a few days?
It can last up to 2 weeks. It's really variable.
All right.
And it may not happen right away, but it usually happens within, a fairly short time period after
from the
exposure.
encounter.
Yes. And then those symptoms over time will go away. And then people all of a sudden are, thinking, oh, it was just the flu.
Yeah.
And don't take it
Well,
seriously.
they probably think it's the flu to begin with until
Correct.
they just heard what you had to say.
Correct. Now, does everyone who gets the flu need to come in for HIV testing? I think you have to put it in the context of high-risk behaviors.
So that's very interesting. So if you have any of those symptoms, that could be a red flag.
Yes.
An important red flag.
An important red flag that would get you in early so that we could determine where you're at with that and determine if we do need to start you on drug to perhaps, treat the disease.
Another question I have is that if a person goes to their primary care physician and finds out or is treated for another sexually transmitted disease such as herpes or gonorrhea, syphilis, genital warts, is a blood test automatically taken for HIV, or do you need to request that?
No, it's not so much that you need to request that. I cannot go ahead and run an HIV test without your full informed consent.
I see. And does that have to be a signed consent?
Yes.
In this state of Vermont?
In our institution, I don't know in terms of physicians' offices and that sort of thing, but in most institutions, yes. It has to be signed by the patient and as again, I can only speak to my institution, but
Surely.
within our clinic and within the outpatient center where you might get confidential testing, the counselor has to also sign that they've done the teaching.
Oh, okay.
Yes.
Very good.
We like to couple our testing with an informed consent, but also counseling. We want to establish the risk, make sure you understand what the risk is, and help you to reduce your risk in the future and keep you safe between the time that you've done the test until you get the result back.
Boy, that's another good question. From the time you have the test until you get the results the week or two later, you're advocating abstaining.
I'm not advocating abstaining.
What are you saying?
I'm advocating anything to reduce the risk of transmitting the disease or the risk of you getting another high-risk exposure. So that may be using clean needles. That may be using condoms. That may be whatever it is to decrease your risk for exposure. So we like to come up with a plan with our patients, and we like to really work with our patients. Even though we don't know their name, we get to know a little bit about them, and we talk about what their risk is, and we talk about how they can protect themselves. And then when the test comes back, either positive or negative, we follow it up with some further counseling.
How has drug therapy for AIDS changed in the last 3 or 4 years, Elizabeth?
Well, we've had the advent of different classes of drugs. We have 3 now classes of drugs. We have over 11 drugs that we can choose from in combination. And it's very important that people are on combination therapy now. More than one drug.
Okay.
Combination therapy means more than one pill, and more usually than one type of pill. And the reason for that is because we know that the virus is very smart and can become resistant over time to the drugs that you're using, especially if you use a single drug. So we know, and we know over time that the drug therapy may fail. So it's very important to be followed by an HIV specialist so that you can have your viral load tested. And we can use the viral load to actually tell if a patient is responding to their therapy. And if they start to fail their therapy, we'll see that with an increase in their viral load. And then we'll be able to take some more of those drugs and more combinations and try to suppress it once again.
Certainly, without question, I would think common sense would that a person who uses good and practices nutrition.
Yes.
And now we're not talking about the one-a-day multivitamin, but takes, on a regular basis, even if you don't have AIDS, but if you're in the high-risk group, that you take, well, I don't want to say specific herbs or supplements, but certainly above and beyond just a multivitamin. It can't hurt, and certainly when nutrition is very important.
Very, very important. And in fact, with the clinics now, we have hired a nutritionist to actually sit down and help us with our patient population and really counsel those patients on the use of vitamins. The other thing is that we know that some of our drugs have side effects,
of course.
And
all drugs do.
And some of the side effects we're seeing is people's cholesterols are going up and their triglyceride levels are going up with some of the drugs that we use. So we're having the nutritionist get involved as part of the team with patients who are interested to look at their diet and see how they can modify it so that they can minimize the effect of these drugs as much as possible and keep them healthy, because we know they're going to live longer. So high cholesterol is very important to keep suppressed. So nutrition is extremely important.
Extremely important.
We are definitely having a very good reception from patients about seeing a nutritionist at this time.
Very, very important. Let's take a little step here and a little jump here. From when a person is diagnosed, the onset of the symptoms of full-blown AIDS can take how long?
10 to 15 years.
10 to 15 years. What a thought that you could have intercourse, anal course with a partner 10 or 15 years ago, and then it's almost impossible to retrack.
That's right. That's right. And that's, again, another reason why it's very difficult. If you look at sub-Saharan Africa, people are infected in astronomical numbers. And it's because it's unprotected sex and people aren't tested, and then they go on from partner to partner. And it's very common in that community to have the male be a partner to many women. So those types of things, yes, are very, very difficult to track and very difficult to go back and say, gosh. And that's why sometimes it's very hard to know who you might have even gotten infected from.
Remember.
That's right.
So that the old adage that if I sleep with a man or a man sleeps with whatever, when you have sex with somebody, you're actually having sex with every person they've had sex with. In a theory, in a kind of a loose context, it really is not such a big jump to say that.
Absolutely.
So what are some of the signs that full-blown AIDS is beginning to show?
Well, some of our patients come and they can be very, very sick with an opportunistic infection. Unfortunately, again, that's why many of them come to us. And as I said, majority of our patients, when they come to us, do have advanced illness. So they may have an opportunistic infection. They may have been seen in the emergency room and they have...
Could you just define an opportunistic infection? Because that's kind of a technical term and I don't have a clue what that is. So if I don't, probably...
Sorry to be technical.
No, that's okay, but just
as
so that I understand.
said, when you have your immune system suppressed, you and I are able to fight off a lot of the bugs that we're exposed to. Some of those bugs, though, when your immune system is suppressed, will actually turn into a full-blown infection, like in the lungs, for instance. A pneumonia that's very common is called PCP pneumonia. So if you are diagnosed with that pneumonia, that is a heads up for a healthcare provider to say, wait a minute, there might be something else going on here.
I see.
So you might get pneumonia, you might have diarrhea, you might have just chronic fatigue, malaise, where you just don't feel well. You just are running out of energy. You're 38 years old, you're used to working full-time, and all of a sudden you can't work. What's going on? So there are many ways that this sort of can manifest itself.
So that would be some beginning symptoms. What might be a next step of symptoms?
You can have, again, based on these different bugs that can grow, you can have any part of your body affected. Some people can actually present with cancers. Lymphoma is something we're seeing in patients with advanced stage HIV. And also Kaposi's sarcoma, which is usually manifest on the skin, but it's a malignancy. So you can have many types of malignancies.
And when a person is, first of all, you try to get the person immediately, because we're summing up here, but immediately when they're diagnosed positive, get them on nutrition and counseling and psychiatric services and whatever services that they need and medications.
And to medical evaluation.
Right, to prevent the full-blown AIDS from coming out.
Absolutely.
And to either hopefully totally prevent it or at least diminish it greatly.
Absolutely, and keep people well, functioning, and as healthy as possible.
And then the second thing is that when people are come into be tested positive and they are into a PCP or some kind of a lymphoma, a cancer, or a lung infection or a pneumonia, that there still are many medications and drug therapies out there. And there are over 11 of them that can be used in combinations even at that stage.
Absolutely, and we can see that when patients come in very, very sick, if they're started on drug treatment, their CD4 count can actually go up. So we can see some kind of reconstitution of the immune system.
We're running down on time. This is Elizabeth McGrath and a very important show on AIDS. And it is affecting everybody in society if you live anywhere in the world, not just Vermont, not just in America. But we need to be very aggressive, and the key really is to wear a condom. And I must say that I have known women who have bragged I don't use a condom. We have that much trust in our relationship. We don't need a condom. I don't believe in it. I don't use it. And brag that this is such a wonderful relationship. You don't know somebody. You're just having sex with them, only knowing them a month. What would you say to that mentality?
Well, again, I think that we want to believe that it's not going to affect us. And we want to believe that here in Vermont, here in Middlebury, here in, you know,
Wherever.
Brandon, whatever. You're right. We just don't believe that it's here. We don't believe that we're at risk. And I think that that is supported by that kind of behavior.
Right. And
I say wear condoms.
wear condoms. Don't be foolish.
And I say wear condoms because it's not just HIV and AIDS that can be transmitted
That's right.
sexually. There are
That's right.
many, many diseases that can go untreated and cause many gynecologic problems.
Absolutely. I would like to just turn the show over to you for the next minute or so and have you say what you feel. You are the director and the coordinator for the AIDS clinic at Rutland Regional Medical Center. New federal grant money is coming in to expand the services and what is needed. But please offer your opinions and what you have to say regarding this very serious subject.
Well, what I'd like to say really, Patty, is just don't hesitate to call that 1-800 number. Don't hesitate to contact us. No question is silly. We encourage people to get the information they need, to come in, to get tested, to follow up with us with any questions or concerns, and that you will be treated in a caring, compassionate manner and also in an extremely confidential manner.
It's really a team approach.
Absolutely is a team approach. Dr. Grace, myself as a nurse practitioner, we have a licensed clinical social worker associated with each clinic. We have psychiatric support. We have the support of the AIDS service organizations. We all work as a team, and it's the only way the work can be done.
Absolutely. And it is our responsibility as adults and parents to teach our children, because bottom line, knowledge is power. For
Absolutely.
me, for you, for our children, for our parents.
Absolutely.
There are cases more and more growing across the country with people who are senior citizens
Yes.
and having sexual relations and contracting AIDS. This brochure is available as Take a Positive Step. Free and available. All you have to do is call Rutland Regional Medical Center at 747-6251.
Yes.
Not bad, huh?
Very
I only
good.
heard it once an hour and a half ago. It's here. It's available where the clinics are. Answer your questions. These clinics are available in Rutland, Burlington, St. Johnsbury, and Bennington. Call. You don't have to give your name. Nobody will know who you are. Ask quick questions. Anything you want. Information is free. Information is knowledge, and knowledge is power. And to preventing this most horrible, despicable disease, it can be prevented. All you got to do is wear a condom. It's not a complicated, expensive situation.
That's exactly
Answer
right.
here.
That's exactly right.
And that's what it's about. And do you quickly have any stats on AIDS in America at this time?
AIDS in America, yes. If I look at the stats provided to me by the Vermont State Health Department, if you look at United States, the total diagnosed patients with AIDS in 1997 was 641,000.
Okay.
And diagnosis in Vermont was 337 individuals.
And do you happen to have a stat there on your handy-dandy notes about how many people are infected with AIDS every minute or every 5 minutes
Actually,
in this country?
worldwide, every minute there are 11 people infected with HIV, men, women, or children.
And you die with AIDS. You still die with it. Wear a condom. It's a bottom line. It's cheap, it's easy, it's available, and it can save your life. I'm Pati Papineau, and thank you for bringing me into your living room. And I appreciate Elizabeth Braff coming in and talking about a very,
thank you
very
for having
serious
me. I
event.
really appreciate it.
Me too, and please come back again.
Thank you very much.
Until we meet again, be happy and drive safely, and think about safe sex, and do safe sex.
Great.
It's even better, right?
Absolutely.
I'm Pati Papineau, and welcome to my show as we continue our series with the Vermont State Police. Tonight we have two special guests. My first guest is Lieutenant Craig Iverson, Commander right here in Middlebury, the Middlebury State Police Barracks. And he is also the captain and the head of the Vermont State Police dive team, which we will talk more about. And please welcome him now. Hi, Greg.
How you doing?
I'm okay. How's your back?
Much better than sitting there.
Nobody can, oh, that's the right answer. Nobody can say we're not thoughtful here. Before we get into the fun stuff of the dive team, which I know everybody is really anxious to find out about, it's a very special, highly trained unit of Vermont State Police. And it's also very timely because we are saturated now on the news with this terrible crash down in Florida where the dive teams are making really a critical difference in the recovery of victims and plane parts. You started with the Vermont State Police 18 years ago in 1978.
That's right.
Born here in Vermont in Montpelier.
That's correct.
And you have a BS in Education at University of Vermont. So what did that degree, and how did that bring you to the Vermont State Police?
Actually, that didn't have much to do with it at all.
Oh, really? Yeah, I never could have guessed that.
Actually, when I got out of college, I did some substitute teaching for a while, and I found out that's something that I really didn't want to do. And my father was one of the original troopers that came on, and at the time he said, well, state police are hiring, so I really started seriously looking into it at that point in time, about a year after I was out of college. And before I knew it, I had a year on, then the years just started mounting up, and I've enjoyed it more and more.
So it was really meant for you.
I guess so.
I guess so. I think it's important that people know that your father's with the first Vermont State Police class of 1947, and that is we're coming up to our 50th anniversary. And I've been working with Bill O'Leary on the 50th anniversary. You didn't know that, did you?
I don't know if I did or not.
No, you didn't.
Probably not.
Probably not. Not very many people know. Anyway, your dad was one of the first in the class, as was Lane Marshall, the former colonel, lieutenant colonel's dad. So I think that's quite interesting. He's still well and living in Rutland, right?
Yes, he's doing
in my
fine.
hometown.
Right.
And of course, our next guest is originally from Rutland. What a small world it is, I'm telling you. So you went and you were 5 years for a trooper out of Rutland Barracks. And then 1982, you went to Colchester. And that's now Williston, is that correct?
That's true.
Right, for only 8 months. And then you went to the training division, which was headquarters then in Montpelier, and then the transition into Waterbury, where the state police headquarters is as we speak,
Right.
and promoted to sergeant. And since 1989, you've transferred to Middlebury, and where you are the commander.
Right. Actually, when I got transferred to Middlebury, I was a patrol commander, which is a sergeant, for 4 years before I was promoted.
What is the highest number of crimes or type of crime that happens in this Addison County, Middlebury area, Craig?
Well, I think it varies depending on the season, but you know, this time of year we have quite a number of accidents. We have a fair amount of property crimes, domestic abuses, things of that nature, burglaries, larcenies, vandalisms.
So warm weather brings out those types of crimes?
It seems
you think?
to.
It does. How many uniform officers do you have in Middlebury?
Our total sworn officers are 14 out of Middlebury.
And then that divided up between BCI and uniforms?
We have one sergeant BCI. We also have a trooper that's performing a trooper detective function.
And who is that?
That's Trooper Ken Newcomb.
And who is our BCI?
Dave Yeston.
Okay. I would give everybody credit, especially right here in Middlebury.
That's right.
You wouldn't be able to go back in the office. What changes have you seen happen since 1989 in the Middlebury Barracks since you've been commander?
Well, I think things pretty much have been pretty stable. Although certainly with the more people that come into the county, people that are living here, and also the visitors, the tourists, that it certainly has gotten busier. I mean, just the rate of crime has increased. So that we've seen, but pretty much it's been fairly consistent since I've been down here.
What kind of changes would you like to see in Middlebury over, say, the next 5 years, Craig?
Well, one of the things we've been looking at, well, first of all, just more of a location standpoint, we'd like to actually move our office so it's more centrally located in the county. That's not critical, certainly, to serve the citizens of Addison County, but it would be nice as far as response time. Also, you know, as I mentioned, the demand for service is going up, and we're asked to do more and more, and it gets very difficult to follow through on a lot of cases just due to the workload. So that's always difficult. We have certainly a group of dedicated troopers that are willing to go the extra mile, but it wears out after a while when you know the potential is there to solve something, and sometimes you just can't get to it when you like to.
Time restraints. How many women do we have in Middlebury?
We have 2 women, a sergeant and a trooper.
Ruth Whitney and Mary Ellen Francis.
That's right.
Boy, I do my homework, don't I?
You do.
Why do I ask questions when I know the answer?
I don't know. That's
I don't either. What a question in itself, right? So you had mentioned in our preliminary interview that something about you'd like video cameras in the car. Do you want to talk about that a little bit more?
Well, actually, we have a few now, particularly with DWIs, where the state's attorney and most everybody involved that a picture shows us that it's worth 1,000 words at least. And,
Absolutely.
I think it's something that the troopers certainly don't mind having. It's really hard to explain something unless you're there and actually seeing it. Stories get changed around quite a bit on the other end, and so it's just really nice to see some of the cameras coming in, and I think the troopers like it. And it's another thing with financial constraints, but we're getting there. We're going to get. We got one right now in a cruiser. And we also have one that's going to be in our processing room for people that are processed for DWI in the office, so that'll be monitored.
You mean to tell me people say, I wasn't drinking, but my breathalyzer test failed and my blood alcohol?
You can assume that.
I can assume that. Well, the world goes on, right?
Sure
If
does.
everybody was honest and fair and decent, we wouldn't need you.
That's probably true.
That's probably true, right? So the video cameras in the car, I think, are very important. Are they permanent to each vehicle, Craig, or are they transferable?
Well, they can be transferred around, but actually the units we have are really designed to be in one car because the camera, of course, is inside near the windshield, but the whole mounting mechanism, it's in the back, in the trunk. So they're really designed for one car. So it'd be nice to have one in each cruiser, but I don't think we're going to see that. But so we can take a little bit of time. In fact, the camera we have in there now in a troop car took almost a day to put in. So it's
really?
quite a bit of an effort.
Oh, it is. It is.
So.
Does it use a standard videotape as we would know it?
Yes.
And it looks so if somebody's looking, they can actually see what appears to be a video camera?
Right.
Do you have to tell them that they're being videotaped?
No.
Oh.
No. You don't have to tell them. I think, well, this is a new thing here with a trooper that has it, but I think he has mentioned it a few times, but we don't have to tell them.
It's
they're
not
being
necessary
taped.
under
No.
the eyes of the law. Let's change our focus for a minute to something that's dear to your heart and you've been involved in for many years, and that's the dive team. So you've been involved for 8 years. No, how many years?
Jeez, let me think about 15 years.
15 years, but we know we have 8 members. How did you become involved in the dive team? What about it interests you?
Well, I always was interested in scuba diving. I went through college and even after, and I really never had a chance to take a course. And it was something I always wanted to do, and it always looked fun and always looked challenging. And it's just something that, in the back of my mind, I always want to at least try. And then it took, actually, I was on 3 years before there was even an opening, because most of the divers that are on the team stay on for quite a long time, because it takes quite a long time to get to the level of where we can use everybody for experience and stuff. So people that are usually on the team stay on for quite a while. In fact, 3 years was pretty good, and then I put in for it at that point. After I was on about 3 years, we had a couple openings.
So I'm sure you had to try out for that and test for that.
That's right.
And are there physical fitness requirements to be on the dive team?
Yes, there are.
Excuse me.
We have a fitness program that all the troopers have to participate in anyway, and we have different ratings depending on what your fitness level is, and it doesn't mean much as far as what it means, but we have to fall within the good range, which is pretty much above average of the average citizen out there, is the best way to describe it. So, most of the divers are certainly good or above anyway, as far as fitness testing that we have to do.
I think there's something here that's interesting to the public is that I went with you and the dive team yesterday up in Lake Champlain. I was amazed at the weight of the equipment. I mean, I thought maybe it was 30 or 40 pounds, and it's far above, easily 60, 70 pounds.
Yes, it is.
With the suit and all the gear?
I've never actually weighed myself before and after, but now I'm really curious to do that.
Yeah.
It is. I mean, I know what our weight belts are. Particularly in the wintertime when we're diving under the ice, when we have dry suits, it's more insulated, so you have to carry more weight. So on your waist alone, you can carry up to 32 pounds.
Well, that's
weight.
what somebody had on yesterday. I forget who it was, but he said, my weight belt is 30 pounds.
Yeah, that's
a lot.
And the tank weighs probably 30, 40 pounds.
And that's not the...
Certainly
They call
not-
it a dry suit or a wetsuit?
Well, there's two different things.
Oh, they are. Well, what did
We
you
were
all have on
using-
yesterday?
We were wearing wetsuits yesterday.
Wetsuits. Okay. They look like frogmen. Well, you are frogmen. Sort of, right?
I guess that's what you call us.
Yeah. But I mean, all of that is weight, and then you had all the knives and various equipment that you
Right.
had. So, you know, it's a very strenuous thing. I know everybody was all light and gay and happy and, you know, talking and chattering. And then when after the dive was over with and took the equipment off, they were kind of like tired for a while.
Yeah, it's actually quite a bit of work.
It's very
and that's
taxing.
One of the
Physically
reasons why you
taxing.
have to be in good shape.
I would think so.
because not so much, well, it depends on where you're diving, but certainly in rivers, and sometimes when you even, like yesterday, when you come up on the surface, when you have to make it back to the boat and there's a lot of waves, you have to actually swim back, so with all the gear on. So you got to be in good shape to do it.
I would think so. Now, what is in-service training that you have once a month with these guys on the dive team?
It's more of a maintenance training. Give us a chance to practice our skills into situations that perhaps we might get called to. Every time we have a dive, we have a mission as far as what we're trying to do and to simulate something we might get into as far as a work dive, whether it's a drowning or a rescue attempt. So we change it depending on what's going on the time of year. But we usually have, you know, a mission. We always have a mission as far as what we're trying to do.
Now, what is more dangerous, in your opinion, to dive in a river or quarry or a lake?
It all depends. Any one of those can be very dangerous. So it depends. I mean, if you're in a lake where it's very deep and no visibility and there's obstructions, it's dangerous. Anything can be. If I had to pick one of what you said based on just that scenario, I would say rivers, just because of the current and the fact that it's very swift water and you can get lodged under something. And it's very tough to swim against the current.
Is it?
If you get caught in it.
I think it's noteworthy here that we say that these guys, a lot of them purchase their own equipment, have their own equipment, maintain their own equipment, go on these in-service trainings once a month at least, more now in this weather. And for all of that, plus when they get called at morning, noon, or night, or a weekend, or a 2 o'clock in the morning on a Tuesday night, they go. They're dedicated for $400 a year. And
that's actually something that's fairly new. I mean, that's not why anybody got on in the first place.
No, it's not a money motivator on. I know. But it's only for all of that dedication and time.
People understand that some states, a few states, they had people just dedicated to special teams.
Right.
All our divers are all full-time law enforcement people that either work the road or have some other position as a full-time trooper. So this is what we do in addition to our regular duties.
Yeah, I think it's absolutely important that people understand that they're not in it for the bucks, and if $400 a year really isn't a lot for what's time and efforts invested, could be called any time. Let's talk about the 8 members. Yesterday we had come down from Derby Line, RJ.
That's
we
right.
had Joe up from Shasberry, Mike Manning, Butch from Rutland,
Right.
Captain Honorary, honorary team member right here from Middlebury, Captain Dean George, and yourself. And I am forgetting, Warren Whitney from St. Albans, at one time was from Middlebury. And I know I'm forgetting somebody.
John Underhill.
John Underhill, Tommy Williams, and Tom Jakes.
You have a pretty good memory.
Yeah, because I just met them yesterday.
I don't think I could have done that, though. That's pretty good.
Oh, that's a compliment?
I think so.
That's the first time. We're moving ahead, folks. Onward here. Now, I think that it's, being that we're in summer and everybody's out in lakes and time of year, let's talk about, it's a little depressing, but how long does it take to drown? Does a child drown faster than an adult?
I'm not sure about that. I don't really think there's that much distinction. I think once you reach a point where you start to panic or you start swallowing water, I've never actually witnessed a drowning. But I've certainly talked to a lot of people that have, other witnesses. And once you start going under it happens very rapidly, very rapidly. You pretty much, once your lungs fill up, you sink.
You do. And something we were talking about yesterday on the boat was that after a body goes below 300-400 feet, usually that's it, right? Why don't you say it in professional terms?
Well, actually, it's even less than that.
Oh, it is?
It all depends on the water temperature and certainly the depth, but even at 100 feet, it's 4 times the amount of pressure it is at the surface. So based on the cold water and how much pressure the water exerts on you, that your body doesn't have a chance to decompose is what it comes down to, and you won't come up.
And Joe was talking something about the stomach gases or something become involved at a certain depth of water, so that the body, just doesn't come up. Once it's gone, unless, of course, some miracle happens, which doesn't really happen.
Occasionally, people come up after a long time, but most of the time, if they're down to 100 feet or more, they don't usually come up.
Now, does water preserve the body?
I don't think water preserves that in and itself. It's more the cold.
The cold.
Right.
Temperature.
And the pressure. So, I mean, with the pressure exerting on the body, plus how cold it is at depths up to 100 feet, then pretty much preserves the body.
So with these divers who were going after all of these crash victims, first of all, I don't know how, it seems to me they've got hundreds and hundreds of, maybe even 1,000, I heard CNN say, of EMS and divers out and Coast Guard and whatnot. What a traumatic experience it must be to pull up a body.
It is, particularly where I can imagine in this situation where bodies are not intact. They're finding pieces of body. And you certainly can prepare yourself mentally as much as you can, but after a while it certainly affects everybody, one way or the other.
And I also think that possibly, and this is what I'd like your opinion on, no matter how much you go on these in-service trainings and all, there's nothing like the real thing. Nothing prepares you for that.
That's true.
That.
That's true.
And you don't forget about it.
There's always some anxiety. I mean, we're very well trained. We train together as a group all the time, consistently. But we talk about it after, and it all depends on the situation, what kind of dive, and how comfortable you are. But certainly, every one of them does affect us one way or the other. And we realize that's our job, and that we have a mindset that we have a mission to do, and we certainly have a function for people. So that's what we think about. And if we took everything personally, as far as looking at them as a person and really getting to know their relatives and friends, it makes it that much more difficult.
Oh, I would think so. It'd be hard to continue on and go home, and live a normal life. There has to be a time when you just, in any kind of accident victim, it's traumatic. But I think that the EMS and people like you need a little extra thought and consideration of what you have to do down there, above and beyond the victims and their families. Another thing that I find is very interesting is, could you tell everybody what the longest time it took you to retrieve a body? I mean, did you not have an incident once that was the body you really thought was gone for like a year or something, and then it surfaced?
Yeah, that's a very unusual situation. That was where some fishermen drowned in Converse Bay, which is on Lake Champlain in Charlotte. We found it was three men that drowned. We found one of them within a day or two, and one of them didn't. And we searched and searched and searched, and we thought we covered the area, and we didn't find anybody at that point. We knew they were down there, but it's a big lake.
Yeah.
Anyway, one of the fishermen came up almost a year later.
A year later, yeah.
Yes.
That must have been gratifying to have the body found when you think it's gone forever.
It certainly does have a closure for the family.
Certainly. Your equipment permits you to go 100 feet?
Actually,
below depth?
we could actually theoretically go 300 feet. I mean, that's what scuba's rated for. We certainly don't go close to that. We pretty much don't go typically on a dive more than 100 feet. And pretty much
that's a lot, though.
That is deep, particularly in Vermont, where it's dark, it's cold, and you can't see anything.
Oh, really?
Yeah, it's a whole different story. You go down to Florida or even up to Maine, and we can see 60, 70, 100 feet of visibility.
Oh, really?
Oh, sure. When you go down to Lake Champlain or any lake in Vermont, 100 feet, you're not seeing much. It's pitch dark, it's cold, and the search area is very confined.
So it's very dangerous. Makes it more
dangerous.
Right?
The pressure down there, and also the fact that you go through a tank of air a lot faster, and you run into other problems with diving.
How long does one tank last?
It all depends on, first of all, the fitness of the person. That's how heavy you're breathing, but more importantly, how deep you are, and how much exertion you're doing. What kind of dive is it? The deeper you go, the more air that you're going to consume. So at 100 feet, with our tanks, maybe 10, 15 minutes, and that's about it.
Do you
it
ever
doesn't
carry?
give us much time.
No, it doesn't. Not at all. Do you ever carry double tanks?
No, we don't do that. We do repetitive dives. So we have our own compressor that we actually fill our tanks, but we don't see the need for doing that. We have other divers to send in, and it runs into a risk of more dive-related problems if you start staying down too long at a certain depth without coming up and making sure you're safe doing that.
On an average, how many calls a year would you say you receive?
It varies. This year, actually, thank God, it's been pretty quiet for us. Other years, we've had 15, 20 drownings a year.
Oh, really?
Yeah, I think the average is probably 10 or 15.
Now, don't you also get called? I know Bernie down in Rutland Barracks was telling me that sometimes he calls you just to look for evidence.
We do that.
Not just bodies, right?
Yeah, we do that a fair amount. I found safes, guns, jewelry, coins. People seem to be ditching a lot of things in rivers and quarries and lakes.
A whole myriad of things, right?
Yes. So we do a fair amount of that. If they have a pretty good idea where something is, we'll go in, if it's safe for us to do so.
And what is the youngest victim that you've ever had?
A 4-year-old.
Pretty little.
That's very little.
Yeah. Very hard for the members of the team, I'm sure, that have children at home.
Yes, it is.
As you do. What would you say would be some prevention things before we wind up here that the public and Vermonters could know about for water safety?
I think it goes down to the basics, and I've been saying this for a number of years, but certainly having fun on the water, but if there's any situation at all where there's any risk of anybody falling in, they're really aware of personal flotation devices. I can think of several incidents, not picking on fishermen necessarily, but people that are in boats a lot that really don't even know how to swim very well, and they don't have life jackets on. I've seen a lot of fishermen drown in 10 feet of water because their waders fill up with water and they sink. And certainly drinking. It's
alcohol, right?
Pretty much like car accidents. I would say the statistics are 50% or more of accidents involve alcohol. So it's mostly common sense stuff.
And it's like how adamant you were yesterday that I zip up my life jacket.
You notice that?
I noticed that 2 or 3 times. I don't know why I'm such a great swimmer.
Yeah, maybe that has something to do with it.
Yeah, right. But yeah, I guess the prevention of anything is the most important factor.
It really
Common
is.
sense.
And
using your head and knowing.
And it sounds very basic, but it's amazing. A lot of times after a dive, you just kind of shake your head like, you can't believe people are doing this. Like going down a river where there's rapids, really not the greatest swimmer in the world, the water's cold, no life jacket anywhere around. Flip over and that's it.
So many of those deaths are needless. That's the sad part.
They really are.
Right.
I'm trying to think. I think I maybe have seen one case that someone actually drowned with a life jacket just because they're in the water for so long. It's kind of like wearing a seatbelt, sort of. But it makes a huge difference. And even if you're a good swimmer, even with our auxiliaries on the water, I mean, the procedure is to wear your PFD and to zip it up. If you fall overboard and hit your head, you're going to sink. I mean, unless you're lucky, someone's going to pull you out.
I never thought of that about zip, because a couple of times I had mine zipped halfway down. I said, zip it up. And I never realized that made a lot of difference.
Yeah, it does.
Even just a couple inches,
It does.
Yeah.
I mean, you could fall when you could just come off you very easily without having it zipped. I've just seen too much to.
You had to take any chance. Oh, I appreciate it. Believe me.
We didn't push you over, so.
No, I noticed. Because you get overtime if you find a body, right?
Yeah, that's
so I said, why don't you throw me over 8 times over and you'll all come out with something. Anyway, it's been fun. It was fun yesterday. And good luck to you.
You too. Thanks.
And we hope we won't have to call you, at least for the rest of the summer.
I hope so too.
Right. Okay. Thank you. Well, that was Lieutenant Greg Iverson, Commander Officer, right here in the Middlebury Barracks, and he's now leaving his seat. So my next guest can come in and plug in. He sits down, has a tie with bread on too. Anyway, I appreciate Greg being here and the dive team, and I hope you found that informative. And my next guest is Captain Donald Ravenna. And Donald Ravenna is originally from Rutland, born in Rutland, Rutland Hospital, Old Rutland Hospital.
Rutland Hospital.
Are you having trouble plugging in?
And it fell off.
Uh-huh. Maybe this is an omen.
It may be.
There you go. How are you?
There. I'm fine. How are you?
Good.
Good.
No, we can't gossip about Rutland tonight.
We can't talk
No,
about
we're
it
on the
all.
air tonight.
We're on the air. We
have
can't
to
talk
be.
about
We
it.
have to be.
Secrets are secrets.
That's right. Gossip is gossip.
Gossip is gossip.
Gossip, right? We don't do that. We're
Not at
strictly
all.
professional. I went to school with your sister.
Yes, you did.
We went to Rutland High School. You graduated, right?
Yeah, I made
I
it.
didn't, but that's okay.
I made it finally.
Yeah, I made it too. And my first day up there, everybody was, what year did you graduate? What year did you, so many Rutland guys on that second floor.
There were a bunch of us.
Did anybody ever figure out what year I graduated? You didn't, did you?
No.
I never told you, did I?
No.
Because I knew you'd all have a Weissmark.
You didn't graduate.
This is true.
You
I got my
found out, didn't
GED. Clear. People are going to believe you. I think it's a joke. I graduated in 1988.
88.
88, don't you like that?
You're a lot younger than I thought you were.
Oh, I'm a lot older. I just look a lot older. What do you want to know? I'll tell you.
You graduated in 1969.
You must have looked it up.
No.
Oh, because of your sister.
You graduated
Because of
with my
Brenda.
sister?
Right, okay.
Gotcha.
You don't have to go back and tell everybody who was 60.
I won't tell anyone.
For the last of that, my last day on the second floor, I'm going to put up a sign. It was 1969.
There you go.
So let's talk about what we're here for.
Okay.
All right, born in Rutland, graduated of Rutland High School, and you joined the Vermont State Police in 1973.
Yep.
How am I doing?
You're doing well.
This is good because this is all the stuff you told me. I'm glad it's accurate.
It's accurate.
That's accurate. And you were in Shaftesbury, which is really Bennington area.
Bennington area.
From 73 to 82 as a trooper. And also you went as a BCI detective, which is Bureau of Criminal Investigation, plainclothes.
Right.
Shall I continue?
Sure.
Okay.
You're doing well.
Oh, I am? Oh, thank you. And then you went to headquarters in 1982, and you were a training officer. And in 1984, lieutenant and captain. December, actually.
December of 84.
December is a very important year for you, isn't it?
Yeah.
Christmas
It
too?
seems that that's when everything was happening. That's when my son was born.
Really?
In December.
This must be
Popular month.
karma or the universe or
Has to be
something.
something. Has to
Ravenna
be something.
in December. And then you became the commanding officer of Troop A, which is Williston. Was not Williston
Right, it
then, but
was
is now
Colchester at that
Colchester,
point.
right. And then back to headquarters in December of 1987 as director of training.
That's correct.
And then in October 1989, you became the commanding officer of Special Investigating.
Yes. Special Investigations Unit. SIU.
SIU.
Yeah.
Well, I knew that. I thought maybe the public didn't know what SIU means.
They probably wouldn't.
Yeah, that's right. Well, go ahead and take it from there. Ta-da. SIU, explain what that all is and what it means. Because you're a unique person.
But I'm not there anymore.
Well, I know that, but I'm not
Okay.
finished.
All right. Well, go ahead. Go ahead then.
Oh, this is great. You're a unique person. Let's let it go.
All right. Let's leave it at that. I am a unique person.
You are, unto yourself, Ravenna. But as far as VSP is concerned, you have a whole array of duties and responsibilities in that office. And I got to tell you something, because very often when I'm up there, I use your office, and you're not there. You're so busy and you're traveling.
I'm too busy to be in my office.
This is true. And I use your office, and you don't know how many people come in, trot right around that corner and say, "You're not Ravenna." They don't say, "Where are you?" They say, "You're not Ravenna." And you know what I say?
Or they say, "Where's the copier?"
Oh, no.
Because it used to be the copy store.
Oh, it did? No, I never heard anybody say that yet. Yes, you're not Ravenna. And I got tired of hearing that. So finally I said, "Yes, I am. I had major surgery over the weekend." People don't just look at me and say, a whole bunch of things I say we can't say on TV. You didn't know I was saying that about you.
No, I didn't.
You get all those little post-it notes I leave you when I
get
leave
those.
you? Yeah, okay.
Yeah.
This is good.
I see those.
You do. You don't say anything, though.
I don't say anything.
Gee, she's here again. Hearing God. Well, back to SIU. Explain a little bit of SIU and what duties you did with the SIU unit.
Well, the Special Investigations Unit included the Organized Crime Intelligence Unit. It included Polygraph Unit, the Governor's Security Detail, and the Vermont Drug Task Forces.
So that's
they
now
they all came under that umbrella. That's now Captain Cronin.
Conan, yeah. Conan and the Banner.
Cronin and the Banner. That's the man.
Yes, the man.
Yeah, he took that over
January.
Right. I was there for 6.5 years.
And then what happened to you in January?
In January,
You moved offices.
I moved offices. We moved the copier back out in the hall, and I went into the copier room and
But that's a nice office.
slid my desk in there. Well, yeah, could be.
You can't miss. You don't miss anything because it's right at the top
Well,
of the stairs.
that's one of
a
the
good part.
That's one of the problems with that office.
If everybody stops in and says hello, you're so popular.
You have a lot of visitors.
I know you do.
Yeah.
Everybody always pops in your office.
Where you're back in a cave someplace, people don't bother with you. You know, they don't stop in unless they really want to stop and see you. But when you're sitting there in the hallway, it can be very
Let's go ahead with the word. Social? Pleasant.
social.
Pleasant,
You become very easily distracted from what you're trying to do.
I would imagine. Well, from now on, I'll just walk right by.
Well, that's why I go to work early and I go home late. Because I got all the visiting time during the
Oh, yeah, you have to
during
make
the
up for that.
middays. I have to get the work done
Yeah,
early and late.
really early. And now, you are the Director of Training, Staff Operations, the Supervisor of Fleet Operations, IAD, which would be Internal Affairs, and you also do a lot of those wonderful things called federal grants.
Got them all.
Did I get them all?
You got them all.
God, I take good notes.
I've got 5 different hats.
Yes, how about that?
Yeah.
What are you wearing right now? All of them. We're going to shift them
well,
all right now.
This week I've been all tied up with grant stuff.
Mm-hmm.
Right now, as I'm sitting here, I'm not wearing any hat. I'm getting ready to go home.
Are you?
Yes,
Are you
I
probably
am.
hungry for dinner?
It's getting toward that time.
Is it really? Well, we just have a few more minutes. Can we have a few more minutes?
You can have as many as you need.
Oh, really? What a great answer.
I'm a nice guy.
That's because we're on the air.
You got it.
Yeah, I know it. Number 1, staff operations.
Staff operations. We just started this. This is a new position, by the way. We did have a position as a staff operations officer, and that was a captain. We had a director of training who was a captain. We had a fleet manager who was a captain. The major was in charge of internal affairs, and the commander of SIU did the grants. So they took 5 positions more or less and melded them into one.
So what happened to all these other captains?
Well,
They
it's all-
retired and so on?
Yeah, we've had people retire. Like on the fleet, I don't do all that much with the fleet. The fleet is basically, it's an administrative job, just helping with the budgeting. We've got a fleet manager who is a civilian who actually does the ordering. He
Dana.
runs the shop. Dana Shop.
Next door to you.
Exactly. You know, I more or less do the troubleshooting, put out the fires and that sort of thing with that unit.
Well, you put out the fires in almost all of these units, don't
Well, yeah.
More or
yeah,
less?
When you supervise them, that's what your
The
job
buck
is.
stops
The
at
buck-
Ravenna's
the buck-
desk.
Yeah, you try to stop it at your desk so it doesn't go any further and go down to somebody else's desk. You know, you don't want it to get up to the major or up to the colonel level. So, yeah, it's a busy job. The staff operations job itself, which is what the position is titled, that deals primarily with planning and research for the department, special projects, just things like that, things that come up quickly on you. We have legislative study committees that may want a bunch of information on the state police, so that would fall on my desk to get that stuff to them. I answer, you know, all the surveys from other state police agencies wondering about how we do this, how we do that, what are our rules and regs on this or that. So there's a lot of correspondence back and forth with other state police agencies throughout the nation.
Do you do a lot with policy and rules and regs in VSP?
Yes. The first Tuesday of every month, we deal with policy and procedure and rules and regulations issues.
And they're constantly changing then, I would think, and updating and
You
revising.
Right. You have to continually update them just because things happen differently from year to year. Different laws come into effect. There's different rules. There's different. A lawsuit may affect the way that we do business. So there are always issues arising.
Or an incident happened that maybe never happened before, and there isn't a rule or
And
reg,
there's
so then
nothing
we
that covers it,
might
so
have to
then-
create one, right?
Exactly.
So that would keep you busy into itself, and you are also the contact person for other state police agencies around the country.
Yes. Yes. I get, as I was alluding to earlier, I get quite a few calls from other departments, and it may be the most recent one, which just happened this morning, as a matter of fact, was the Washington State Patrol. They're going to redo their hiring process.
Oh.
So they had contacted me back a few weeks ago for information as to how we go about hiring, what we do in our hiring process, and then I was on the phone for about a half an hour with the gentleman today because I sent him the packet of information. He had a lot of questions about what does this mean, what does that mean, type thing. So we're always trying to help each other. You know, if I need something, if we need to know how many departments carry long guns, carry rifles in the car, I'll be charged with find out for us, Don. So through my contacts with the other agencies, I'll get that information and bring it back to staff.
So it's always something different and new and interesting.
Every day, you know, it's a lot different than on the road. On the road, every day you're dealing with something different, but that never changes in police work. No matter what rank you get to, there's still something different that's happening every day. You know, it's just
not always good.
It's not quite as glamorous as Craig going out and, you know, swimming around Lake Champlain and being paid for it today and enjoying
on a 90-degree day.
Right. But
don't forget the Chinese food part.
The Chinese.
He can't
food,
hear us.
Yeah, he can hear.
Oh, he can hear.
Oh, I'm sure.
Oh, yeah. He's not saying anything.
He just.
It's a miracle. He's not making any comments.
Right.
So you have your staff meetings and your surveys, and that unto itself is time-consuming and very involved responsibility.
Well, any one of the units that I oversee could be a full-time position.
Oh, yes.
Legitimately. It could be a full-time job to do it 100% the way that it should be done. Unfortunately, because of all the manpower shortages and the budget problems that we're in, we don't have that luxury of. We should have a planning division. We should have at least a couple of people. That's all they do is long-term
That's their
planning
full-time job.
and strategy for the state police. We don't have that. So it's a lot of management by crisis, you know, whatever the biggest crisis is today.
At the moment has to be.
That's the thing that we're
what
going to
you
address
handle.
today.
Right. Now, the fleet operations, that includes the ATV vehicles, the boats, cars, and snowmobiles.
Machines. Yep.
They're all owned by the Vermont State Police.
They're all owned by the Vermont State Police. They're all
have to be maintained and taken care of and purchased and all that. And then you have the Internal Affairs unit, which is IAU or IAD.
IAU.
IAU here. Some places it's IAD. You hear that, right?
Yeah. May be a division versus a unit.
And that is, define that for our viewers, if you
Well,
would.
the Internal Affairs unit, basically, it's pretty straightforward. Anytime an allegation of either improper conduct or misconduct is made against a trooper in the state police, it's reported up through the chain of command. And it goes directly to IAU. It also goes to the colonel and the commissioner. If it's a misconduct, which is basically the criminal side of things, like
committing a felony?
Yeah, taking bribes.
Committing murder?
Yeah,
something. I mean, so that our viewers understand.
Really
a crime.
Something that's a crime. Then you know, there's legislation that requires us to contact the state's attorney in the area where the complaint came from, and to notify the Attorney General, put them on notice that we've received a complaint that a trooper did X, Y, or Z. Then we'll assign somebody. We have one full-time investigator, and we have a number of part-time investigators, troopers and officers out in the field that have other duties also, but they've also been trained in internal affairs investigations. They'll go out and do the investigation on it. Then the investigation, once it's completed, it's forwarded through the chain of command. If the complaint's against a trooper, then his station commander is going to read the investigation, know everything there is to know about it, then he's going to comment on it. Then it goes up to his troop commander, which would be the captain in this area, would be Dean George. From Dean, it would go up to Major Valley, who's in charge of the field force. Then it would go into the lieutenant colonel.
And then
it would go. I get to see it. Yeah, I get to see it on its way up between the colonel and the commissioner. I'll review it, and then it goes to the commissioner and legal counsel.
It's
And
a big,
then
big
it goes to
letter.
SPAC,
What's back?
which is the State Police Advisory Commission.
Oh, yes, it's a
with
civilian
Karen
board.
Bradley, the
My
civilian
friend
board.
Karen's on, right?
Exactly.
Karen Bradley.
They'll review it to see what the outcomes were on it, see if they agree with the decisions made or if they don't. And, there are civilian oversight just to make sure that we're doing what we're supposed to be doing. And we take it very seriously. I mean,
Of course.
We have to police ourselves.
People make mistakes. That's what we have to lead it.
Everybody's human.
Yes, we're
you know.
human.
There's
Mistakes happen.
No
and
one. We've got
Nobody's perfect.
one of the most stringent hiring practices anywhere in the nation, and we still end up with people that make the wrong decision at the wrong time. It's human nature.
Well, it happens in every profession.
Every profession. There's none that are lily white.
Nobody's perfect.
No.
Want to move on?
Sure.
Okay. What a great concept.
Moving on.
Yeah, federal grants. Let's
Right.
go to money
Federal grants. Okay. I do
for local police.
Yeah, at the present time, we've just got a new grant that just came out this year. It's called the Local Law Enforcement Block Grant Program. There are a number of direct awards that are being made by the Bureau of Justice Assistance in Washington, but there's also a state award that's being made. So currently what we're doing is trying to devise a formula to get money out from the state to every local department who qualifies. It's really a bear trying to do that.
Sure.
Because the unfortunate thing is whenever the state police name is on it, then there's always somebody out there that might think, well, the state troopers have got it, they're going to try to keep all the money for themselves.
Oh, really?
Oh, yeah.
Well, that's sad because that's not what it's about.
Sure, it's sad, but that sort of
It
stuff
happens.
So
So
what we're
that
working
you're
on
there
right
to
now-
dispel that.
Exactly. I mean,
Well, go ahead. This is your public
I'm
forum.
not there to steal anyone's money. I'm there to make it get out the door as
Yeah,
fast
right.
as I can and onto somebody else's
Yeah,
desk
right.
so that they can
Right.
start using it for what they need it for.
Right.
So I think we've come up with a real fair system based on Part 1 crimes that should be pretty much bulletproof. And then I've got
And then that not only, well, let's go back for a second. From my notes, it's not only local police departments, but it's the sheriffs.
Well, this newest one is just local police, but then
Okay.
we have one that's an ongoing grant that we get every year, and that's the burn drug grant.
Right. That I've heard
Okay,
of.
that we fund the Vermont Drug Task Force with that, which is local officers and state police and sheriffs from time to time. We also fund the Attorney General's office. We fund the Defender General's office. We fund the State's Attorneys Association. We fund corrections. We fund the courts. We fund, to some extent, we've been funding some training initiatives in Pittsburgh. We've been funding some DARE programs. We've funded canine training. So there's quite a conglomeration
Oh, yeah,
of people there
It's a big pot.
that get involved in that grant. And it's
I thought it was kind of interesting that you give money to grants to the Attorney General, which would be the state's attorneys,
Well, yeah,
and the
state's
prosecutors,
attorneys
and the Defender General, which are the public defenders.
right.
Like two ends of the coin.
Well, yeah, but
Am I right?
You're definitely right. But you have to do that because if we increase our presence in the drug field, we make more arrests, then we need more prosecutors to handle the prosecution.
Right.
Well, the defense needs more defenders.
To
I
protect
mean,
them.
it's all part
It's
of
a domino effect,
It's
right?
all part of our criminal justice system. You don't get a fair treatment. It wouldn't be fair to us to say to the Defender General, no, you're not going to have any money. You just make do with whatever your state appropriation is, or you go find money some other place. So we don't spend a lot of money on them. Don't get me wrong, but we do try to help them out with the problems that they have over there.
And you also get involved with these QZ and Newsy units. Let's talk about those because I think they do
Koozie,
wonderful.
Newsy, Foozy, WIN. There's
There's
a
not
lot
one
of
in Rutland.
There's a lot of
Next.
acronyms out there now.
Yep. Well, explain what they are because I think they're wonderful units.
Well, the
don't you?
Koozie, yes, I do. And Koozie's been around the longest. It's more or less the model that other counties are trying to model themselves after now to an extent. Koozie stands for the Chittenden Unit for Special Investigations. The concept in Chittenden County that we're trying to spread statewide now is that departments donate investigators to a specialized team that focus their investigations on child abuse and sexual assault investigations.
Sex crimes.
Sex crimes for the most part, but they do other abuse type things too, because it's really a specialized area when it when you have to interview children, you know, dealing with someone who's been the victim of a violent rape. It's not something that everybody can just step out of a cruiser and go to work doing it.
No, and they take time.
They take
lots
time.
of investigation,
they're
interviewing
very involved,
processes,
and it's not all just police work. I mean,
No.
you have to
And it's
be
very
aware
sensitive.
of what all the resources are for that person. You know, because we're there to help people. It's not just go out and arrest the bad guys, although that's our goal, obviously. But at the time of the crime and in the intervening weeks until that guy is caught, that woman or that child is going to need some sort of support systems. So you've got to be up to speed on what those support
and before they
systems
go
are
to court
be able
and testify, and if that comes to that, which it
So
can.
it's a great concept that works. It works extremely well in Chittenden County, and they've started up a couple of others now, being what I call floozy, but it's actual Newoozy or something.
And
Franklin
Newsy,
unit,
the Franklin, and then the
and
Newsy
then-
unit,
Yeah, and you've got Wynn, which is the Washington County.
right.
And hopefully we're going to be able to get enough funding to get a few more of these units off the ground, because they really do work.
Yeah, they work beautifully.
They work great because it's a multidisciplinary approach. You know, we have people, we have.
We work with
victim
SRS
advocates with
and the
them,
advocates and
SRS
the
people
and the state's attorneys, and
it's
we don't
just-
have one in Rutland, but being a Rutland native and all, I'd like to see one going down there.
It wouldn't hurt.
Hmm.
It
Work
wouldn't
with
hurt.
Kevin Gino and Shawwacker and Stanton and Monchon. Maybe they're listening.
Well, it's.
Would you like to see one down there?
It's a great concept.
It is, and it works.
The only thing that hurts it, or that prevents them from coming online, is strictly the dollar
The money, yeah.
issue. It's strictly a dollar issue because
know.
they're expensive to run.
Was it Warren or Jim Cruz up north said that, you know, they begged and borrowed, because we don't steal on the VSP, but they begged and borrowed to get the sofas, because it's an environment. I think people should know this. It's not a police barracks. It is a separate unit and an office, like a living room, where people can feel comfortable if you've been assaulted and you're a victim, and, you know, to get the sofas and the desks and the phones and all of this. And the atmosphere is different than walking into a barracks, and that's not where you're at.
It's definitely expensive, but it's definitely worthwhile.
Worthwhile, absolutely. Now, what is the Law Enforcement Coordinating Committee, Don?
The Law Enforcement Coordinating Committee, that's run out of the United States Attorney's Office. U.S. Attorney Charles Tetzlaff is the chairman of it. The Law Enforcement Coordinating Committee includes all the federal agencies that operate in the state of Vermont and all Vermont criminal justice. We have state's attorneys, attorney generals, the sheriff's departments are represented, the Chiefs of Police Association is represented, the state police, of course, are on it, corrections. And basically, the LECC meets to discuss strategies as to what's happening in Vermont, what's the crime picture, where should we be focusing our resources, etc.
And you are very directly involved with the disbursement of these monies.
Well, yeah,
and going over the monthly and quarterly.
Right, we go over to LECC quite often with all of our burn money. We hold a meeting to discuss priorities as to where we should be spending the money. We like to get everyone into agreement ahead of time so that there's no fighting over, well, he got more than I got.
Right, which can happen.
It can happen, because everyone that comes to the table has a good program. It's usually a program that's under one of the authorized program areas, and they're all worthwhile.
Oh, absolutely.
But there's only so much pie.
Yeah, right. There's only so much pie, and
So it really becomes just an exercise in what are the priorities. You know, what
And
does
they
Vermont
change.
really need this
and
year?
they change from year to year.
They change from year to year.
Absolutely. You know, you've done so well as a native Rutlander,
Thank you.
and I'm very proud as a native Rutlander that you are done so well in your career and been so successful to attain the status of captain in Vermont State Police. Speaks that you've
Fortunate.
had, well, and also It's very commendable. And I'd like to ask a couple questions. We are winding down a little bit, but what do you think are the qualities that make somebody a good trooper?
That makes a good trooper?
Mm-hmm.
The very first thing is you have to be compassionate.
Mm-hmm.
You have to understand when you stop the guy with a junky car driving down the road, that doesn't mean he's a bad guy necessarily. He might be a bad guy.
Might
He
be
may
poor.
just be some guy that's working a minimum wage job and trying to raise 6 children.
Absolutely.
So, and you have to understand that when people are under pressure, that they're going to react a lot differently than what they would normally be reacting. So, you have to have compassion for the people that you're dealing with. You have to have integrity.
Mm-hmm.
Okay, there are a lot of times that you can do things wrong.
Mm-hmm.
You have the opportunity to do illegal things. You see it all the time.
There's
Drug
temptation,
searches.
right? Tremendous
Drug searches.
temptation.
You know, where you go in there and you're searching some guy's house and you come across $5,000 in cash or $20,000 in cash. Or a few years ago, we grabbed $1.3 million in cash.
Oh, that's nice.
Yeah.
What a concept.
So, you know.
1.3 mil in front of you.
Yeah, it's a lot of money.
Does it cover a bed?
It's a lot.
Does it cover a kitchen table? Does it cover a
It's more
sofa?
than you're going to be able to pick up and carry away.
Oh, I bet. that doesn't surprise me in the least.
But so, you know, you have to have that integrity. You have to have the honesty. You have to have compassion. You've got to care about what you're doing. It's not, you know, it's like the Navy saying, it's not just a job, it's an adventure. Well, this isn't just a job either. It's a way of life. If you're a police officer, then you have to live the life of a police officer. It's hard to do sometimes.
Oh, absolutely.
It's very hard to do sometimes. And that you get put into a lot of uncomfortable situations. You may go to a party with your wife where her work, Christmas party, and half a dozen people there might decide, well, let's do a joint.
Oh.
That happens. So a lot of times you have to make decisions that sometimes your wife says, well, it's no big deal. Well, yeah,
Well, it is.
Yeah, it is.
It's illegal.
I can't be here.
Right, absolutely.
You know, and you've got to be strong enough that you can say, well, time out, I'm out of here. So there's a lot that comes with being a cop. I mean, you have to have a very understanding family.
To have an extraordinary, kind, sensitive, caring, intelligent, and flexible wife. You can't come home to crap.
Flexible is key.
Flexible is the key. Kind, caring, and flexible all the time. Absolutely.
All the time.
I mean, you can't come home to
Right, because
miserableness because it,
when you come home from a
see it
bad
every
day
day.
at the office, of course, in the position I'm in now, after 23 years, I'm not out there dealing with the domestic violence and with the abuse and with the motor vehicle accidents.
But still, it's stress.
But
High
I came
stress.
on this job as a trooper.
Doing that, right.
I've been there. I've done that. I've got the T-shirt.
Right, you understand.
I understand it all, and my wife was very good about it. Although there were times that she wanted to tell me all about how bad the kids had been that day, and I just come from an accident where 2 kids had been killed,
Right.
and I have to say,
Very
well,
hard.
wait a minute, you don't understand how fortunate you are that
That's right.
that you
That's
had
right.
the opportunity to correct the kids today.
That's right. That's right. You go back to
There's
basics.
another family that's not going to do that.
That's right.
So, and it's tough on the wives, because then they, you say something like that, and then they feel terrible that they said anything to you, and then you have to say, well,
If you're lucky, you got one that feels terrible.
Yeah.
Otherwise,
So
it's
it's
just a big
it's-
argument.
It's as hard for the wife and the kids as it is for you,
oh, absolutely. I would think so. I would think so.
because you can't go home and tell them everything that went on.
Oh, you certainly can't. Not even if you could, you shouldn't, because you need to go home and unwind and relax. You have to let it go.
Home
You
has
have to
be
let
your
it
own
go.
place.
Yeah, absolutely.
That's your safe place.
Quickly, could you define professionalism for me and our viewers?
Professionalism. Boy, that's a tough one to just define right off the bat. But,
You can do it.
Well, I say professionalism is just doing the best that you can do every day that you're out there. If you're giving it anything less than your best, or if you're treating anyone just a little bit less than they should be treated, then you're not being a professional.
What about honor? That's a good word. Yeah.
Honor, well, honor kind of hangs in
and
there
we're
with
with
pride.
pride, integrity.
Pride, integrity,
But
that whole ball of
honor
wax.
is good at all.
It's like, when you're a trooper, it's like to me, it's similar to if you're in the service, if you're in the Air Force, the Army, the Navy, or the Marines, which one automatically to the public is the best. they're going to say, boy, Marine Corps, you know. And you talk to a Marine, and, you know, when they get out of boot camp, they'll walk through a door without opening it because they just know
That's
that
their
they're the
training.
best.
Yeah, right.
Right. But that doesn't mean that they aren't just as professional in the Army,
No, absolutely.
in the Navy,
Absolutely.
and in the Air Force. Well,
I
when you're
agree.
when you're on the Vermont State Police, you feel like you're the best. So you always try to be the best.
Try to be the best. Abide. Do the best you can.
You got it.
Live by the rules and the
got
regs. And treat
Be
people with
happy that
compassion
you're
and
wearing the
decency
green
and-
gold
and
know that
above
it
all, do
stands
the
for
right
something.
thing.
Do the right thing.
do the right thing. And even when you
always.
screw up, try to do the right thing, but try to do the right thing.
You can make mistakes, just recover from them and learn.
There
from
you
them.
go. I like that. I'm going to use that.
Nothing wrong with making mistakes.
Mistakes. Just recover from them with dignity and
You got
class. What a great note to end on. I really appreciate your time and your effort in coming
very
down
welcome.
here from headquarters today and melting in the heat because we have to turn the air conditioner off in the
It's been
studio.
warm.
It is. It is. It's a little sauna up here with the lights and the air conditioner off because we couldn't have the hum. I thank you for watching and bringing me into your homes. I appreciate your giving us this time, and I hope you have a better insight into the professional, terrific people of the Vermont State Police. More series to come. In the meantime, I'm Pati Papineau. Drive safely and be happy. Thank you. Hi, I'm Pati Papineau, and welcome to my show. We have a jam-packed hour with 3 completely different guests, and so I don't think I'm going to waste a lot of time talking. I think I'm going to get right to my first guest. Thousands and thousands and thousands of you wake up to his voice every morning. He's given away hundreds, probably thousands of prizes on the Mystery Oldies 92 game twice a morning, 7:30 and 10:30. And so I thought it would be nice to everybody to meet my good friend and to really know that there's a real man behind that voice. Please welcome the one, the only, Jim Knight from Oldies 92.
Patty, it is a pleasure to be here.
Thank
I'm
you.
honored. I'm honored. I thank you very much for asking me to come.
Well, you're on the hot seat now. This is a
I'm
change
nervous
for
because
you.
I've never done this before. This is something like, usually I'm on the mic and
Yeah.
you're looking at 4 walls, and now this is a completely different situation, and I've never really been on camera before.
So how do you like it?
Well, I don't know. I don't know. I'm not sure yet.
Well, I
But
think you're doing great. Now, let's talk.
let's talk.
You know,
Let's
like
get down to business.
Joan
right?
Rivers always says, can we talk?
Can we talk? We probably could.
I know that you came originally from the Boston area.
Right.
So how come you don't have that Boston accent?
I
Tell me
kind of
about
had
that.
to go. I kind of had to go to voice lessons to
Right.
get rid of that. That was.
And it wasn't easy. Those lessons are not easy.
No,
or to get
you
rid of
gotta-
Southern accents or anything like that, right?
Right, you have to really concentrate. You have to go through a lot of, listening to your own voice, which I hate to do. I don't
it's
know
so
why
great.
everybody hates it. and it's just, it is a time-consuming thing, but well worth it.
I would say.
You really, I guess, in pro broadcasting, you really wouldn't want a dialect necessarily, and a lot of people try to lose that. I didn't even know I had it until I started applying for work at different stations, and they all said, well, you're going to have to lose the Boston dialect.
See, of course,
And let me go park the car, and then I'll take care. So you have
You
to,
can bring it back just like that, right? Just like that Brooklyn accent. It does
Oh,
come back.
you can get it back if you
Yeah.
want to, sure. But yeah, you have to go through a lot of lessons to.
It's fine-tuning the ear
Yeah.
to the tonality of the
Yeah.
voice, wouldn't you
Yeah.
say? So what I'd like to know is, when did you decide to be a DJ? Did you wake up one morning as a kid and say, that's what I want to do? Or did it just kind of evolve through time and when you were older?
I was very young when that happened.
Tell me.
I remember when I got my first radio, a little portable radio, and it was given to me from my parents. And I found a radio station, and they were playing rock and roll, which at the time was back in the 60s, and the Lovin' Spoonful and the Four Tops, and,
The
the
great
whole
stuff.
9 yards, the great songs. And that took me away from the TV and just I would listen to the radio day after day and be fascinated. Love the music. And I was about 5 or 6 years old, and I remember my parents saying, I don't want you to listen to rock and roll. Let's find a better station for you. And no,
right?
this is exactly what I want. And I always knew, ever since about that point, that was pretty much what I wanted to do.
So you were really a little kid when you set your goals and your sights.
Yeah.
What kind of training does somebody have to go through to become a DJ?
Well, you should go to, if you're in college, you can take advantage of a college radio station, which I did. You can...
Sort of like on-the-job training with those college stations, right?
Yeah, they have, usually they broadcast to like the campus or something like that. And then you can also try to get a part-time job, which I did a little bit north of where I was going to school. As far as how to go about getting to be a DJ, I would say you don't need a degree, a college degree necessarily. You should go to college, though, I think, to get certain courses. Speech lessons are always good and things like that. You got to show them how you sound. You make a tape. They're interested in how you sound, what your knowledge is on music and whatnot, what you can do for them, basically.
Well, a lot of it's personality on the radio. You've got to be glib. I mean, anybody who's good and good like you are, they've got to be sharp.
Is there somebody else in the room?
No. But that's true. When you say you got to like people, you got to like what you do.
Sure, it's communication.
And real sharp, quick-wittedness.
You're right. Because it's communications. You're talking one-on-one with
and
people.
Constantly, you don't want to keep repeating the same kind of sentences and the same phrase all
No,
the
you
time.
can't.
All the time.
Right. There's a lot of similarities.
Or it gets boring and you don't have an audience.
Yeah. There's a lot of similarities to what you do on a daily basis, but yet nothing is the same on a daily basis. Every time you, like any other radio show or television show, every time you do it, you try to say different things. Make it sound different. Make it sound fresh. Or the person who listens daily, day after day after day, will say, well, this gets awfully boring if you say the same thing every single time.
Oh, yeah, sure.
Sure, you have to work on the words, as it were,
Maybe DJ is kind of an old-fashioned name I'm using. I'm dating myself because there's no more turntables and drop the 45s. Those days are long gone.
Right.
I've been in the studio when you've done that. It's all computerized. It's amazing. I mean, you must have to take courses in computers and to know, because it's absolutely mind-boggling.
A knowledge of computers is definitely helpful.
More than a knowledge. I mean,
you really should.
Unbelievable.
As these days, more and more stations are going to use computers, have gone with computers. Most equipment these days has gone digital.
Yes.
And it really helps to have the knowledge of the computer.
You know what amazes me? To interrupt you for a second.
No, go ahead.
Sometimes I'm there and I pick the 10:30 Friday drawing for you. We'll tell everybody that I do that. We know.
Talking about mystery oldie game, and where we play a little teeny tiny piece of a song, and it's basically a name that tune situation to get qualified to win a prize.
Well, what amazes me is that when you're there in the few minutes before, no matter what song is playing on the air, and if we're talking and your beautiful wife Diane is there, and all three of us are talking, you can just instinctively know those 3 or 6 bars when that song is going to wind down and leave. It's just like instinct, no matter what song is playing or who the artist is, instinctively, it's like that. And it's an instinct. There's nothing else. You probably don't even realize you do it. But you know all these songs and the bars, and it's more than just knowing the words or the phrasing. It's you really know, and it's the music, the notes, and you know them so perfectly. It's amazing. I compliment you on that.
I thank you for that. Yeah, like I say, I've been listening to music since I was 5, 6 years old. I love the songs. I still love the songs today. To me, they haven't lost their appeal one bit. Fabulous music. To me, it's the best kind of music.
Oh, it is. I mean, no matter where I go, people say, oh, Oldies 92, that's all I listen to. I was born and raised in Rutland. I go back to Rutland. My best friend in Rutland. Everybody says, you have no idea. Everybody listens to Oldies 92. And you hear, everybody can hear on the station, people call in from New York.
Oh, the audience
from New Hampshire.
Terrific.
I mean, the audience, the scope and the geography is unbelievable.
An absolutely fantastic audience. And they know their music, too.
Oh, they do,
don't they? You wouldn't believe the phone calls. It's amazing.
Yeah.
People, we have never, in over a year ago February, it will be going on 2 years in February, we have never, ever, ever had a stumper.
Oh, you haven't?
I have never picked out a song yet where somebody didn't call within a couple of seconds of hearing the song that's the same old song by the Four Tops, or that's Frida Payne, Band of Gold, or whatever it might turn out to be after hearing just a little teeny tiny clip, and it is amazing.
I can name that song in one note, or sometimes the phone starts ringing before you play the song. And I think to myself, I can name that song in no notes.
In no notes.
Really good.
They have to be really good,
Really
I'll tell you.
good,
And
yes.
I pick up the phone, and they think about it, and more often than not, they get it, and sometimes they say, I don't want any part of this. Let me think about this a little while longer.
Yes.
And they'll hang up and try again.
Well, it's intimidating. You think, well, I'll never get in, and then all of a sudden, hello, and you say, is tonight oldies 92? What's it get? And all of a sudden, if it was me, and I've never called in, of course, I would probably go blank. Just hearing that you
Sometimes that
really
happens.
picked up
That's
the
what would
phone
happen
and
to
I
me.
got lucky and think, oh my heavens, what was it I was going to say?
That's why I'm glad I do the announcing part, because I know if I had to play the game, I would sit there and say, and yet I've known the songs for years. Sometimes that does happen.
Yeah, you just get under a pressure block, and that's it. There's nothing you can do.
Oh, sure.
So, and then it's nice people get on, and they want to talk, and they're working here, and they're on their way to work,
Find
or
out
they're
what they're
doing this at
doing,
school,
yeah.
and it's really nice. And what else is nice is that I've done a lot of DJs and a lot of work all over the country in radio. You're the only person I ever knew that gave people 2 chances, and I think that that's really
That is
kind
something
of you.
that,
That's unique.
Originally the judge,
You know?
the super judge, I'm the judge, we have a super judge, and he said 2 chances. I don't know if you should do that. No, I do want to give people 2 chances, only because, 1, sometimes people are a little bit nervous when they go on the air, and 2, as you mentioned, you can draw a blank.
Oh, easily.
I had one this morning. I had, do you remember Knock 3 Times, Tony Orlando
I had
and
that
Don?
one. It's the first time I've had one since I've moved back to Vermont and listened to you.
You got that right away.
That's the only one I got.
I had somebody tell me that it was another one of their songs because Candida, because we played the clip and it was such a short clip. The correct group, but the wrong song. I want to give that person another chance.
Yes, because they're like
come up with it.
close but no cigar. But that's nice of you, and I've never known any DJ that what's the word I should call you?
Announcer, DJ, I don't mind. I don't mind DJ.
I never knew an announcer that was nice that did that. And usually the minute, no, that's not it, click, and you start another one. But you always are nice to people. Try again, and you talk to people, and you have the personality, and you're personable as well. And that's what the key is.
We have a lot of fun.
If I ever get married, will you come be, the announcer, do some DJ songs?
Why, yes.
In my wedding?
Yeah, no, of course.
I suppose that, hey, anybody, if you have a Christmas party coming up, or a New Year's Eve party, or a wedding, or anything, do you do that sort of thing? Can you do that sort of thing?
Yeah, my wife and I both have done that in the past, and we continue to, do it.
Oh, I think that would be great.
Somebody wants dance music, we can do that.
Well, you certainly have your fingers on all the hits and any songs anybody would want. But see, there you go, everybody. You can, instead of hiring a DJ or somebody that does it part-time,
we come to you and we'll bring the music.
And get the best.
It's been done that way before many times.
I think
we have a good time
great.
at those functions. Yeah. So somebody can, if they're interested.
I call you at the station. Drop me a line at Box 438 East Middlebury. I can pass it on to Jim.
Sure.
And I think that would be great.
Sure. If anybody has a dance coming up, most anxious to hear. And make it a great time.
Right. Dance, wedding, party, whatever function sounds fun.
But the oldies are my favorite kind of music. People often ask, do you really like the music you play? I don't think I could really do it very long.
No, you couldn't do the good job you do if you didn't enjoy it. It's true of anything that we do in life.
Sure.
If we don't really enjoy it, you aren't going to be a success at it, and it'll be more of a pressure than something positive.
Yeah.
And that's not what life's about.
That's true.
We got to be happy in life.
Absolutely. You don't wake up at 3:30 in the morning, 4 o'clock in the morning to get up there and not have a good time.
People don't realize you're up sometimes in that studio 2:30, 3 o'clock in the morning, 3:30, and those are long, long days. A lot of people probably listen to that. Oh, it's 12 o'clock. Hey, that's a nice job. Guy can go home, and he's got the whole day free.
Yeah, bye-bye.
Hey, he's already been there for almost 10 hours. So it makes a long, long day.
You have to get in early. There's a lot of prep to be done with each show, as you know with this show.
Yes.
As we've been going through hours of prep work.
Sure.
That goes into a good show.
It has been great. I'm so glad you came tonight.
Patty, I am honored that you had me on.
Everybody has to know that you're on first, but you go to bed early.
What time is it now?
Well, let's
we're
see.
doing the taping.
Probably better.
And it's
Getting there. We're getting
here
there.
As we tape, it's 7 o'clock at night.
Yes, it is.
Usually, I'm in. I might be waking up for midnight snack right about. No, I usually go to bed about 9:30.
Yeah,
I wake up
early.
about 3 o'clock, 3:30. Yeah.
So that's-
Yeah. And an afternoon nap never hurts if you can
I
get one.
agree.
It's not always easy
I
to
don't
do.
I don't have to go to work at 3, and once in a while I get an afternoon nap in too. But I'm so
never
glad
hurts.
that you came.
Patty, I thank
it's
you.
delightful to have you.
Oh, it's a pleasure. Anytime, Patty, and you have a wonderful show. I've heard a lot of
Thank
successful
you.
things. You've done
Really?
4 so far. I believe you told me
Yes.
this is the 4th.
Yes, it is.
And it looks like it has a fantastic future, so I wish you all the
Well,
best.
thank you so much.
You're
I hope so.
welcome.
We try hard.
I know you do.
It's
It's
just
going
great.
well. It's
It
going
is.
well.
It is.
Patty, thank you.
Thank you.
All right.
Okay, and there he is, the one and the only Jim Knight.
Yep.
Oh,
Thank you, Patty.
thank you, Jim. Well, my next guest is somebody that's also very, very interesting in a completely different field, a completely different profession. And as you may have known, a couple weeks ago on a previous show, I had on the famous coloratura opera singer and vocal coach, Dee Tighe, from Manchester, Vermont. And one of my little pet peeves in life is that as I was a professional dancer and a dance teacher, people do not realize that to teach dance, to teach music, to teach the fine arts, gymnastic, in this country, you need no licensing and no certification whatsoever. And I have always said, because dance is the field that I know best, that if there was certification, 90 to 95% of all dance schools would be forced to close. That's how bad and poor the instruction is in this country. Now, many of you have heard me say in previous shows that I have just recently moved back to Vermont. And one day, driving up to Burlington, on Route 7, I stopped in Tennybrook Square. And I walked into a school that said Gym Star, and I walked in out of the blue. I never met my next guest before. She didn't know who I was when I walked in the door. But I want to tell you that I was so impressed with her professionalism and her school. She is the owner of Gym Star. It is a gymnastics school only. And she had a class going that day of maybe 6 or 7 little tiny kids, maybe 3, 4, 5 years old. But she had 3 instructors for those kids. And for gymnastics, that's what you have to have. That's one of the basic criteria, because parents, believe me, gymnastics is considered high risk. And even in insurance, when you want to go to buy insurance, it's much more high risk than, say, ballet. So she runs a very professional school. I was very impressed with all of her equipment, thousands and thousands of dollars of equipment, which is also very important to have. And as I started to say a couple minutes ago, one of my pet peeves is growing up, and even today, you see dance schools that say ballet, tap, jazz, gymnastics. You go in, they have a little 5-foot balance beam 2 inches off the floor, and they call that gymnastics. Or oftentimes you might see it as acrobatics or whatnot. So anyway, I thought tonight we would kind of zero in a little bit on my next guest. I would like to have you meet Shelley O'Brien, owner of Gym Star School in
Thank you
Shelburne,
very
which is South
much.
Burlington. Thank you. I'm
Thank
glad
you for that
came.
big introduction. That was
Well,
great.
That's the way I feel. It's so important to have quality instruction. And we're lucky to have you in Vermont, and I want to invite you down, and I want to ask some specific questions. If we have parents out there, what are some of the 2 or 3 things that they should look for in a good gymnastic school?
Right now we have probably over 7 full-size gymnastics clubs in Vermont.
Do it.
And they're all governed under the USA Gymnastics Federation. When you do go in, you would like your instructors to be safety certified, first aid, and CPR certified.
Sure.
Would be, I would say, the minimum criteria. You would like to see an instructor who's very enthusiastic, works well with kids, and can have a good grip on class management.
And background is important. That's something I've always said. I don't care. It doesn't make any difference if you're teaching gymnastics or ballet or karate or swimming or hockey. You're only going to be as good as your teacher. So if you're going to have a teacher that has no background, maybe just did gymnastics in high school and decides at 35 or 40 or 25, I want to make a couple of dollars a week, I'll go teach gymnastics. think about that. That's the kind of training you're giving your child. And although you might say, well, it doesn't make any difference. It's only fun and games. It's only once a week. But I think, Shelley, you'll agree. You never know. When you take your child in, your little boy or your little girl for lessons, you never know who's going to be the next Nadia Comaneci or Mary Lou Retton. And it's much easier to take somebody who's had no training and give them good training than it is to take somebody who's had bad technique and try to redo it in anything. Don't you agree with
and
that?
then there's a lot of programs too that are geared towards a team program, or you have your recreation classes that come from 1 year old up to 12-year-olds. You have clubs that are geared more towards team. My philosophy is more for movement, to let the kids have a good time, but use proper progressions to make sure they're learning skills safely and making sure they're progressing as well. And keeping it fun, light.
And happy.
Correct. You want them to keep coming back.
Yes, and that's another thing that I think parents have a misconception. I know you and I talked about this after I introduced myself, is that little kids' classes that you teach, you do specifically go up to around age 12. But little kids' classes, when they're 4 and 5, 3, 4, 5 years old, their little arms and legs are shorter. They get tired. They start yawning. I'm tired. When do we go home? And that's what you get after an hour class. An hour class for little kids is too long. For gymnastics or ballet or whatever, a half an hour or 45 minutes is the limit. They should go home still happy, still full of energy, not tired, not want to go to potty, not hungry, and that's a philosophy you have, and I think it's just great.
And with gymnastics, there is so much equipment involved in it.
We can get tired much
I know with
faster.
dance studios, you go in and you just have a
Just the
room.
bar. Yeah,
And to me, I would feel very overwhelmed how to keep them busy for a whole hour. But with children 5 and under, 45 minutes seems to be plenty long for a class. We do a warm-up with music. We go through the 4 events. We have floor, balance beam, bars, and the vault skills. Everything is set up on a creative path for them so they can learn with the instructor as well as go through the different events. We do a closing with parachute, some type of rhythmic activity that lets them experience music that way.
You are the chairman of the Vermont Federation for Gymnastics, is that correct?
It would be the Vermont state chairman for the USA Gymnastics.
I think that's
and this
great.
would be governing the competitive program. And we have gymnasts in our state, probably over 150 of them.
Really? That's great.
Levels 1 through 10. And we set up qualifying scores, qualifying meets, and then a state championships. Through this process, they can then go regional and then international competitions.
And then, of course, onto the Olympics if they're really good, right?
Right.
That's the ultimate
In Vermont,
step.
it's quite difficult to, get that recognition. Our numbers are quite low to keep the competition up. But there is certainly possibility, for a college scholarship going through this program.
Really?
A lot of sports, it would be through the high school team programs, but with gymnastics, you'd have to belong to these private clubs to really get national recognition and collegiate recognition. And most of the kids are going through that route.
Down where I lived before I came in New York, they did have what you call the clubs, and I knew some of the kids, and they were really training vigorously. I mean, this was a real full-time commitment. I mean, after school, they were going for hours. And the same thing on weekends, and every weekend it seemed like they were going out of state or someplace for a different meet. So it becomes, I would imagine, very costly, but also it's a deep commitment on the part of the parents as well as the kids. And you have to be careful on your nutrition and what you eat and the safety factors involved. There's so much involved. Don't you think, Shelley, that the Olympics has made a big difference in bringing gymnastics to the forefront in this country in the last 10 or 15 years?
Definitely. And
In
with
popularity.
this year being an Olympic year, you usually see a big growth in your programs.
Do you?
You see all the little kids that are coming in and they say, this is what I want to be when I grow up.
Yeah.
Or really grow up. I mean, these kids are only
They're itty-bitty.
14 to 18-year-olds who are competing
Yes.
out there in the Olympics. It is a wonderful sport, but it is very demanding. There's a lot of negative things that I've heard about it, but I think in the long run, children that do participate in this sport, come through very positive, they're very confident, and they're very focused with their direction of what they want to do with their life thereafter.
Well, I think that's all up into the coach and the teacher,
exactly,
and how you run your school. And there again, that's another reason why it's so important to get your child, and you have lots of little boys as well as little girls, into a good, professional, well-run, well-organized school with at least a couple of teachers for every couple of students. I'll tell you a terrible experience that I had, and I don't know if I told you this, but when I was a little girl, about 7 or 8, I was not in a gymnastic class, but I was in a dance class where one of the girls was doing like a somersault. Back then it was called acrobatics at the end of ballet, or tumbling, or it wasn't anything on parallel bars. But she broke her back. She broke the spine in front of me. I never forgot it my entire life. And that girl wore a body cast from here, only her part of her face showed, down to below her hips. I never forgot it. She was in a body cast for a year. And right then I said, boy, if I'm ever in a position where I can help parents and educate the public so these things don't happen. I mean, accidents happen. God forbid.
But
we have
severe.
them. But that is severe. It was totally unnecessary because she wasn't watched.
Right. Well, the ratio that the USA Gymnastics Federation recommends for children 5 and under, it would be a 5 to 6 to 1 ratio, and thereof it would be 7, maybe 8 tops. I find with the 5 to 1 and 6 to 1 seems to work the best. And then you want to have stations set up where each child is being able to perform skills safely on their own, where there's not an instructor that they need to be there all the time. So there's many skills, balance skills, coordination, strength, flexibility, where they're not really needing a spot right there. And then a good teacher would set up a lesson plan where those would be incorporated, and where there is a need for a spot, that's where the instructor would be. Under the USA Gymnastics, there's many different accreditations that they're trying to govern throughout the United States, right through preschool, through the elite level.
Oh, that's good. So they're trying to set up a national guideline, national certification for all gymnastics schools. Well, that's great news. They should do that for more of the fine arts and all. That's great. Any idea when that might come into fruition, Shirley?
For the gymnastics, it's happening right now. That's been going on for the past 10 years, that there's different accreditations. There's a kinder accreditation for preschool level teachers. There's accreditation for level 1 and 2 coaches. There's safety certifications. There's national and regional clinics that are going on all the time to inform you of different progressions, nutrition, sports medicine. So if you're really into the sport, you should be involved with the USA Gymnastics. There is a professional membership that you can join, and with that you receive all this information, as well as Technique magazine, a gymnastics magazine. And if I think you're there to work with the kids, that you would want to be involved in this organization.
So this is for teachers you're talking about, the accreditation and all this, for specifically geared for teachers at whatever levels they might want to teach, along with the safety aspect and the nutrition, because it all goes together. The instrument you're dealing with is your body. You know, you can take the piano and get it tuned, but what you're dealing with here is the body, and it must be properly tuned in all ways. And today we're also nutritionist conscious, and supplement and vitamins, and these kids have got to take care of themselves if they really want to progress and do well.
If they're a serious athlete, you know, that's full-time. Most of the kids in Vermont who are level 5 work out 3 days a week.
Do they?
And for 2 to 4 hours at a time.
That's
go
a long
up to
time.
level 9 to level 10, and they would be working out. The coaches would like them in the gym 5 days a week, which is a very demanding schedule if they're trying to keep up their school schedule.
Oh, of course. Something else that I'd like to point out here is that you focus basically your school up to about 12 years old, and I think that that's wonderful.
I try to plant the seed in the children. The competitive program is not where I really wanted to excel. I love seeing children have fun. I didn't want to make it serious and competitive for them. We just have a real good time. We have great music, lots of color, and if kids are very talented, there's many other clubs that they could go to that would carry them through their competitive program. But for me, the preschool and recreation is where I would like to specialize in.
Well, that's, first of all, you know, as a professional, you know your capabilities and where you really are happiest. So that shows a professional right there. And it also is another thing that shows a professional, and we talked about this with my vocal guest, who was a soprano with the Milan Opera and the Vienna Opera, is that part of being a professional in whatever field you're at is to be able to say, okay, now you're done. I've given you the best I can give you. I've given you a foundation. I've worked here. Now, if you wish to go on, you need to go someplace else. This is where you go. And that's the key to the whole thing. So many times you'll get talented kids in all fields. I don't care if it's karate or hockey or gymnastics, but teachers, you get it, and you work with her, and you get her to the point where she's really good in your studio. She's like the studio star. Yeah. And you don't want to let her go. And in fact, I've even known cases where teachers get really jealous and mean and possessive is the word about letting their star pupil go on and get better and progressing. And that's not, if you really want to get good in this world, you have to go on, because one teacher and one coach isn't going to give it to you.
I agree. I think through a gymnastics career, they have their preschool, their low-level coach, and then eventually they would have their elite-level coach. Correct. So there's usually 3 coaches, you know, through their life. To take one from preschool right through, I think is very rare. And then there's a lot of gym hopping, kids going back and forth and having conflicts in gyms and
that's hard too. There's too much jumping around isn't good either.
No.
In anything.
I think in Vermont, though, we're spread out enough. Our clubs range from Brattleboro all the way up through to St. Johnsbury. And then we get together for our state meet, and it's really nice to see the growth coming in gymnastics in Vermont.
Well, Shelley, let me tell you, I think that your school is so great. You should have one here in Middlebury, because we tape here in Middlebury. Most people don't realize, but we tape here in Middlebury, and you should have one in. You should have one in every city in the state, so that kids can come in and learn the coordination and the skills, even if they have no interest in becoming gymnasts professionally, but to come in the program that she offers at her school is so wonderful. The kids are so happy. You should offer this all over the state. And I'm talking
that would be great. I would love to.
Hey, listen, I'm talking as a mother and as somebody who's been in the profession and knowing that this is really something every kid needs, and they don't get it in normal half-day preschool, and they don't certainly get it when they get to kindergarten.
Now, I strongly believe that all children should be involved in gymnastics sometime in their preschool life. Yes. If they don't go any further in their career, they can take it anywhere into their academics, into other sports. I always hear parents coming in and saying, "Oh, my ski instructor asked me, does your daughter take gymnastics?"
See, well, it kind of spills over.
And you can just really see the coordination, the balance, the positive attitude, and because it's not a team sport, it's an individual sport.
It certainly is.
And it makes you feel good if you're being successful, and I think that carries on into life.
I'm so glad that you came tonight.
Well,
and
thanks
I
for
hope that all
inviting
of the parents got a little insight into this very extraordinary, highly competitive field, but a good basics of what we have available here in Vermont and what you offer, and that you are highly professional and accredited.
Thank you.
And that's so important. And so I'm glad you came tonight to share this time with us.
And if
I appreciate it.
other coaches or people interested in knowing more about the USA Gymnastics Accreditation, they could call me at my phone number at 802-985-2160, and I can give them further information.
Your recommendations of accredited schools around the area?
As well as getting more education if they are already involved in a program and would like to professionalize their program more so.
That's great. Well, I hope they do that.
Okay. Well, thanks for having me.
Thank you so much. You're done for tonight, though. We're not going tumbling tonight. Right? Well, now I'm up. We're getting down to the end of our show, and my next guest is also a very unusual person. highly professional and highly trained. She lives right here in Salisbury, Vermont, which is really like Dunmore area. And I have always said that one of the things that I'm going to do in my show is to offer people who are in the field of alternative medicine, because as I've said, we have so many diseases today that we just cannot cure, as we all know, cancer and AIDS, but we have many debilitating and chronic illnesses. Millions of people suffer on a day-to-day basis, and sometimes traditional medicine doesn't work, doesn't give you relief, or sometimes there is no traditional medicine. Now, in the previous show, we had a naturopathic doctor, and today we have a massage therapist. Now, there's all kinds of massage therapy. There is the Swedish massage. There is the acupressure massage, where they use the fingers, not acupuncture. That's where they use the very fine needles with the hands. And then my next guest has two forms of massage therapy that are very unique and unusual. I had the lovely experience of trying them out last week, so I can talk here firsthand tonight. But please welcome Dawn Decker from Salisbury, Vermont. Hi, Dawn.
Hi, Patty.
How are you?
Good, thanks.
Thank you for coming.
Thank you.
How long have you been a massage therapist?
Well, I've been doing this work for about 10 years now.
Have you?
And started my study in New York City at the Swedish Institute of Massage Therapy.
Okay.
And now live in a little cabin in the woods in Salisbury. Never
Yes,
thought
that I know.
go so far.
Uh-huh.
And continue my studies with a number of different doctors as well as therapists of different massage techniques.
What kind of training does a massage therapist need to have
Well,
to become really...
in the state of Vermont, there are no requirements. So
Really?
There's no state licensing. I am licensed in the state of New York.
Are you?
And, but in this state, it's sort of wide open, which is nice in a lot of respect, because a lot of people have the ability to touch and to heal and have a very good feeling. But unfortunately, then you get a lot of people that get into the business and put out a shingle and haven't
Maybe they
had
aren't as
the
professional.
anatomy, the physiology,
Right.
the pathology that might be more effective. So there is some change to going to a national certification,
There
but
is?
that's coming along.
Little by little.
Yeah.
Everything is unfortunately very slow in some respects in this country, and it's a shame because there can be such help for people, you know, and you need to know, and that's one of the reasons I bring alternative healing and specialists on like you, because I want people to know that you exist and you are highly trained, highly professional in your field, and that it's not a field of, I hate to use the word, but quacks. You know, sometimes people use that term. It's not nice, but sometimes it's descriptive of something that's not accurate. Now, I think that I'd like to have two people... people realize the two kinds of massage therapy you do that are very unique to Vermont as well as to the whole country. And one is this lymph node massage therapy. Everybody knows, we hear of lymph node cancer, and you hear of the lymph nodes when you have various diseases, they swell, or mononucleosis. And I always thought the lymph nodes were just, as you had told me, that there are hundreds of lymph nodes all through the body.
Yes, the average person has about 800 to 1,200 lymph nodes. And the last year I've been studying a method called Dr. Vatter's method of manual lymph drainage.
And that's from Germany and Austria, is it not?
It is, and it's a very gentle, rhythmic, light way of working the body. It helps alleviate pain as well as supports the immune system.
Does it?
And it's very, very relaxing. And basically it's just rhythmic movements over and over in a very methodical way. Every part of the body is worked on in a certain system.
And it drains, the massage that you do drains these lymph nodes, so it keeps them healthier.
It does.
I would think.
It does. And for somebody who's having acute pain, of course, it can be very, very effective. Last night at 10:30 at night, a neighbor called and said, "Oh my gosh, I'm in such pain." And what I did with her was, I said, "Well, do you want to come over right now?" And so she came over, and I worked on her late at night. And I think she was able to sleep. And I did mostly the MLD, manual lymph drainage. And it's good. My work is quite eclectic. I've studied so many different things and sort of combined them uniquely for what each individual person is needing. I use some pressure point and some Swedish massage, which is basically muscle kneading, and then I do some acupressure, like you were saying, with the thumbs, with the palms, with the elbows. And then I also do what's called muscle testing, which is finding some weakness in the muscles and then balancing using different neurolymphatic points as well as some vascular points in the face and the head.
The head, I don't think people realize the stress in the face.
So much
So
in
much.
the jaw,
Jaws, yes.
in the scalp. I noticed
Yes.
today myself I was having a little headache, a little pressure up there.
Do you get it?
I had a
Who does
session
your?
today.
You give yourself a session.
No, actually, I have a good friend that I've been teaching.
Oh, good.
And she came all the way down from St. Albans to
Really? Oh, that's great.
to work on me this afternoon, and my voice got a little lower because I sort of got relaxed and calm. And she was doing an energy kind of work called Reiki that
I've heard
I'm
of
not
that.
real familiar with, but except for experiencing through her.
Well, I was found it very interesting last week when you told me that you have people that come to you on a regular basis from as far away as Boston and Canada and New York just for one of your treatments. I know that I thoroughly enjoyed it. I was feeling better. I was even breathing better. I could feel like, I don't know if it was my sinuses or the lymph nodes, but they were all draining, and my whole head in the area felt better.
Well,
And,
so
you
many
know?
people come for so many different kinds of reasons. You know, a lot of people come just for stress and relaxation, and which is a very important reason. Some people wait to come until they're in pain, till there's an injury.
And that's probably more difficult to work with.
It is, because,
you know.
when somebody's in pain, they basically, want to be fixed.
Yes, instantly.
And I
Magic
hope
with your fingers.
that I hope that I think I work most successfully with people that come on a regular basis, that are sort of wanting to grow in a spiritual way, as well as connect with their body, to connect nutritionally, to connect exercise-wise, and to just grow in their relationships, in their work, and to understand, sort of what their body says to them.
Can you define what a regular basis is for our viewers?
I see some people weekly.
Once a week?
Some people every other week. Some people when they can. I have one person I see once a month who comes from New York, and it varies. I try to encourage everyone to listen to what their body says they need, and sometimes that's more frequent, but sometimes finances are in the way as well.
Could you tell me, let's just say that I'm a viewer now watching the two of us converse and say I never heard about massage therapy. Do you have to take all your clothes off? I'm sure people are asking, so I'll ask for them.
Okay.
That's what I'm here for.
Well, I say, come in and take your clothes off.
Oh, really?
No, I don't. No, they say that to me sometimes. No, really.
No. We'll get back on track, folks. We will get back on track.
No, really. They come to me, and we usually do, I find some background about them, their medical history.
Right, a history.
I need to know, there are some things that are contraindicated. So we want to make sure they have no recent strokes or heart attacks,
Right.
or
maybe what medications they might
what
be taking
medications
currently.
they're taking, who
if
their
any.
MD is. If
Yes.
sometimes they've been referred, I do have a few doctors that refer patients to me,
Oh.
as well as I work right now at Wells Physical Therapy here in Middlebury.
Oh, do
one day
you?
a week.
And what do you do there?
Massage therapy.
Oh, wonderful. That's
Trying
great.
to integrate and incorporate a little bit more into the traditional
Healing.
field, as well as in my cabin setting, which is a very different setting by the wood stove. And I'm enjoying having those two variants of places.
Now, how long does the average massage therapy take?
Well, a lot of people do hour sessions or can have a half-hour session. I work an hour and a half just because I want people to have that time to relax, to do the talking they need before they get on the table. And then I like to give them the space when they're on the table to be quiet and not have to talk. Some people feel more comfortable talking and chatting away.
You mean like me?
Because sometimes, you know, when you're being touched, and a lot of people have not been touched except for by their parents or by their family or in a sexual way. And so it's a different experience to let somebody else touch you and to let down your guard. So sometimes emotions do come up, other kinds of feelings. Sometimes somebody will feel like laughing, and that will be sort of an emotional release.
Well, this is totally non-sexual, and it's like if you ever go to a beauty parlor and somebody's giving you a shampoo and they kind of massage your head for a couple and think, oh, doesn't that feel wonderful? Or if ladies have a manicure or pedicure and the technician just puts a little cream and massages your hands or your feet, you think, isn't that wonderful? So it's really kind of doing the whole body, because we don't realize the stress that we carry with us, not just in the face, but all over in the back, and boy, it's just wonderful. And then, now you use oils with it.
I do, and I've studied
massage.
this kind of therapy called orasoma,
And what is that?
which is based in England, and it's a color therapy based on vibrational medicine and vibrational healing, like homeopathics are. And sometimes I use some of the colored oils with people, and sometimes I just use them on their body, as well as sometimes I use some crystals and stones and some aromas.
Now, what would be the purpose of using crystals? I would imagine stones like a rose quartz, or what would be the purpose of using?
Well, they're
something?
all just energy
Are
and
they?
vibration, and so the color as well as the mineralization. And I've studied some about it, as well as just do it intuitively. And like rose quartz, for
It's for the
example,
heart.
is for the heart.
Yes, that I know.
You can feel, you can see, you can smell rose, and you can sort of know where that goes.
It's been proven to relax and to help people with chronic heart problems, the rose quartz and the stones and the crystals. I have known that and studied that. So I think that's really fascinating.
Well, I think all illness and disease is to help us keep in line on our path in this lifetime, to have a purpose, to deal with our relationships and relating in our community. And that when we get sick or when we have pain, what I hope to do is to help people in a relaxed state to become more conscious and aware of how they can deal with it, as well as using medication and hospitalization and surgeries. You know, that there are alternative ways and helpful ways along with those traditional ways,
yes,
as well. And then we can all work together, and we can all be happier and healthier. And
it works. I mean, that's the most important thing. It works. I know you use like eucalyptus oil for somebody that's got a sports injury or an athlete. And I know myself, I like the rose oil. But there are various oils you use for different purposes, because it's also a person is inhaling those fragrances. So they're also very therapeutic too. It's called aromatherapy, and we're not doing a show on aromatherapy, but it all is connected to the body and the mind, and feeling better. And also preventative health is involved here, so that don't wait until you have an injury or you're in acute pain, you have acute trauma to the body, immediately have to run to somebody. But it's also like a preventative, and to keep the body more relaxed and healthy. And I think there's something else that it does, that I've had many massages over the years in my life, being a dancer and all, and it helps your circulation.
oh, definitely.
People who stand, or people who drive long hours in the car, or people who sit at desks, you know, it's not good for the muscles or the blood vessels or anything. So it helps the whole body, and it frees it up like you can't imagine until you've had it done. But it is really, truly a wonderful science that's, what would you say, thousands of years old?
Oh, definitely.
Definitely. What brought you to Vermont? Why did you come here?
Well,
we're so glad you did, but what was the initial
I had been in New
lure?
York City, actually being a model and doing a whole different lifetime. And I got married and moved here and bought a little farmhouse, and that didn't work out so well. And so I built this little cabin where my son and I now live. And I do my business and my work there part-time, as well as in Middlebury part-time.
Well, I know the universe takes us all on a lot of separate paths, and sometimes if one door shuts and for whatever reasons other doors do open. And it was like meant to be that you are in this very beautiful, peaceful setting, and that you offer this healing technique and therapy to so many people.
Well,
And what do you think is the most important quality for a massage therapist to possess?
oh my, I never thought of that question.
Oh, well, go ahead. You have a couple seconds.
I think compassion is important. Yes, I guess the compassion and love and intention. I think the intention to be there for somebody or to heal or to care, to listen, would all be important.
Understanding, and I think the compassion and the love of what you're doing, like we talked with Jim Knight earlier, really loving what you do makes all the difference, and having compassion for humanity.
And often I feel it's not me that's doing it. It's just, it's like this other energy and this other feeling coming through me. And even though I've had training by so many various people and various techniques, that sometimes it's this other feeling that comes through me to help. So it's not me. I hope my ego can get out of the way sometimes.
But it is, I mean, it's your hands and your work and your presence that's there.
And I feel I like to help by continuing people's healing with giving them suggestion for meditation, relaxation. I sometimes spontaneously will do a little meditation at the end. I give them some yoga stretches or suggestions as well.
I know you also instruct in yoga, which is also very good for the body.
Yes, we have some new classes going to be starting soon.
Oh, great.
Through the rec department here in Middlebury.
Here in Middlebury, that's great. Could you tell our viewers what a massage, average cost of a massage would be, maybe in Vermont? A ballpark figure, or?
I would say anywhere from $35 to $60 here in Vermont.
And that would be an hour?
Yes, that varies from hour to hour and a half.
Okay. Do you feel that it's necessary to have a full hour? I know sometimes I see some massage therapists advertise half-hour sessions. Do you feel that they can do?
Sure, I'm adaptable to what somebody wants. Like, we never got back to your question about what does somebody wear. I let them wear whatever they feel comfortable with. You're usually draped, you're on a table, you have your privacy to come and dress and then get redressed. And you work one body part at a time. And I let people leave their underwear on if they're more comfortable. And some elderly patients who it's such a burden to get all the way undressed.
Sure,
I can work with their clothes on. I can work with them sitting up or lying down. Pregnant women on their sides as well. So I hope to be flexible with all those different varieties. And what was your question again? Where were we?
Well, unfortunately, we're almost to the end of time. The hour just seems to fly right by, but I'm so glad that you're here in Vermont and practicing and successful and able to help people and to help heal people, or at least give them relief, make them feel better, and certainly make them feel better. Even if you don't come in with a particular problem or an ailment, you just feel better when you leave after having a massage, a good massage from a professional therapist, and that's what you are, Dawn. And I really appreciate your coming to my show and giving us this time, and maybe giving a little bit of insight to my viewers on, what it takes to be a massage therapist and what's involved, and all kinds of things that you need to do. And I just think it's real important, and people can understand how long a massage can take. It's not going to be an afternoon whole thing that you're going to tie up a large piece of your life, and that it's within cost effective. Let me ask you just another quick question before I leave. If somebody, say financially couldn't handle a price that a massage therapist has of $50 or $60 or $35, are you or some massage therapists flexible and work on a sliding fee scale, only because I assume that you don't accept medical insurance? Unfortunately, but I mean, do massage therapists take that into consideration?
I had a client file today for his insurance, and we're hoping that it will pay with a doctor's referral and with New York licensed state,
Oh yes,
a
that's
state
right.
license from New York. So we're hoping that will pay. I've only had that happen a couple of other times. So we're working in that direction.
Well, I think it certainly is a field that needs to be, along with a lot of the fields that we've talked about in the fine arts and instruction and teaching, but and therapists, massage therapists, they need to be accredited, affiliated, licensed, because when you go to anybody for a service, you need to feel confident within yourself that you yourself are receiving the best that's available, or that you're sending your child to the best instruction that's available. And you can't do that just by going to somebody who's in the Yellow Pages, or somebody who's got a business card, or hangs up a sign in front of their house, or in front of their garage, or downtown, or wherever, that necessarily means that they're expert in their field and their training, because oftentimes, unfortunately, they are not. Dawn, I hate to say goodbye, but I do appreciate your time and your effort.
And I will work on a sliding scale to answer that question.
Well, I didn't want to ask again, but I felt that if you wanted to answer it, you would. Yeah, I think that's...
I do, because I feel that, people have, and I've had to ask people at times in my life, too. And people, especially here in Vermont, have been very willing to work with where we're at financially.
Well, that's part of what life is about, is giving. And everything you give in life and you help people, I
love to barter.
It comes back. I love to barter, too. Well, we're almost out of time. I really hope that everybody enjoyed the show tonight. We had 3 completely different individuals and guests, 3 professionals in their own field. And that always makes me happy that they can come and they can share with you some of their own personal life and their experiences, their background, their training, and what advice they might give to you, the public, for, if you wish to get trained, or to have a child trained, or just so that you get to know a little bit more about individual fields that sometimes we can't always cover in newspaper articles or on other medias, where time is under great restraint, and TV commercials and so many things are limiting the focus of a show. So I'm glad that you allowed me in your living room one more time and in your home. This is our 4th show, as Jim was so kind to point out. It's just a pleasure for me. I really would hope that you are going to continue to watch our show. We have more wonderful guests coming. We have a show coming up in the very near future with the Middlebury High School marching band. Some of the members will be right here in this studio. Imagine that. We all are coming in early that night. That will be a big night. And we have some very talented musicians in the area, and that will be, I think I'm going to work that into my Christmas show. So I hope that you'll all stay tuned. And as I told you before, we're going to have the Jim Mangione, the state's attorney, coming in, a show not to miss. Very, very important for every child. Yes, I said child, because we all go to school, we have social studies and government that kids have to take, and anybody that's a Vermonter, because you are going to learn what the jury system and the selection of the jury system is like in Vermont. And let me tell you, the days of having your boss write in a letter saying, so-and-so can't be on a jury because he's too valuable at work, are long gone. The laws have changed drastically, and I don't think most Vermonters are aware of it. Doctors today, members of the clergy, it's almost impossible to get out of jury duty. How the system works, how the court system works, how the jury system works, how state's attorneys work, their caseloads, and what's going on in the state of Vermont. It's going to be a really interesting and informative show, and Joe and Jim will be with us this whole hour in that particular show, and I know you're going to find it most informative, because I found it informative just talking with him a couple times briefly. So I hope you're going to look for that show and stay tuned to it. And as I say, plan the VCR for that one, because that's something that you're going to look back on and you'll think about and redo. And who knows? You never know when you're going to walk out the front door and be a witness to an accident, or be someone, hopefully, that's you won't, but that was murdered, and be called to testify or be called on jury duty. And it's important to know what your rights are, what the laws are, what's expected of you, what's not expected of you, how long it can take, what you get paid or don't get paid, and all kinds of facets of that whole interesting field. So until our next show, thank you for watching. I'm Pati Papineau, and be happy.